Welcome. Good morning, everyone. My name is Melanie Green, and I am the community representative for District 4. We're going to go ahead and start with introductions, and then we'll go into our business. I will just call folks out. Rebecca, can you help me by calling out the folks that are in the room? And then I will do the Zoom attendees, please.
Yes. We have in the room David Poland and Alicia Topper.
Good morning.
Good morning. Oh, do we need to do roll call? Sorry.
This would be roll call.
Okay. And then we have Rob Perkins. Do you want to introduce yourself really quickly?
I am Rob Perkins, attending as the elected representative from District 3.
And Joyce Cooper?
Yeah, Joyce Cooper, elected official. I think I'm District 5 because I keep getting confused between the school board district and the county district, what district I'm in. So I think it's 5. I have to look it up.
And Lance?
Good morning. I'm Lance Carter, community member from District 5.
Great. And Amy?
My name is Amy Rourke, and I'm the community representative from District 1.
Amy.
And Ellie, I'm the low income rep for District 1.
Staff, Vanessa?
Good morning. I'm Vanessa Gaston. I'm the director for Clark County Community Services. I work with Rebecca and Michael.
Janet? Okay, we'll come back to Janet. Michael?
Good morning, Michael Torres at Clark County Community Services, Program Manager. I work with Rebecca, Vanessa, and Janet.
Thank you. Janet, are you there to introduce yourself?
It looks like she had to log off and log back in.
Okay.
Janet is staff with the Clark County Department of Community Services.
Great, thank you. And did I miss anyone? Speak up now. All right, we will get started. Thank you so much for joining us. We have a pretty full agenda today, so we're going to go right into it. I'm going to turn it over to Vanessa for the Community Services Director update. Thanks for being here.
Thank you. And hopefully 2023 is starting off well for everybody, but thank you for allowing me to have a little bit of time on your agenda. Rebecca graciously sent out some attachments that I just wanted you guys to kind of get a sense. I'm not sure if how many of you know kind of what community services does for the county. We're kind of the social service arm of the county. We contract out the bulk of our funding to nonprofits, small governments, and other jurisdictions. We do have some for-profits we work with. There is a handout that just shows you all of the highlights of the major programs that we are responsible to administer for Clark County. We do countywide. We do not focus on any particular city or jurisdiction. We are countywide with all of our services. Most of our funding is federal, state, and we do have some local funding, but we really have to work hard in all of our program areas to piece together the funding to leverage so we can provide services in the community. And so I wanted to make sure that you had the org chart because we do have some new staff that we were gracious for the county manager and county council to approve that we will be hiring in. And then also to let you know, every year in December at our all staff meeting, we celebrate all of our accomplishments. And I just wanted to share with you all of the hard work community services staff did in 2022. And so, and later, if you have any questions about that, I'm not going to go through all of those PowerPoint, but I do want to highlight what our priority is going to be for 2023, which is kind of the last slide, about slide 32. And I'm just going to kind of touch base on each of those areas, and I'm kind of start from the bottom. One is we are continuing to administer The COVID relief funds for the county as it relates to rental assistance. We did get some federal dollars around the community development block grant. And so we are continuing to do that. Michael and his staff in the business unit did a remarkable job during COVID, quickly putting that money out. And I'm talking, it was a lot of money that came through our department and to our community across the state, though. But it also showed how frail our safety net system is, because a lot of the providers just had a hard time, especially the homeless providers, taking in that kind of money because they just didn't have the staff. It was COVID. There were a lot of things going on, but I want to really commend Rebecca and Michael and the rest of his staff, Jan and the rest of them, along with Abdul Majid and his staff in the business unit, because they rolled up their sleeves and really got busy to make sure that the people in our community got the assistance they need when it was a very stressful time. But that didn't mean our work stopped. We had our regular work we had to continue to do. We had to pay for our help, pay for the providers, help them with technical assistance, help them figure out how to deliver services during a COVID period across the department. So I just want to say we will be continuing to do that. The next thing I want to talk about is we do have some changes to some of our programs that I just kind of want to highlight. Our developmental disabilities, primarily we have two focuses there. One is we work with babies to 3, helping families with supports. We do some information referral in the community for people with intellectual disabilities. And then we help as a person who graduates high school, and they want to find employment, we work with providers to find them employment. So if you ever go to a grocery store or to a hospital and you see people with intellectual disabilities working, that is one of our programs that we are working with providers to find them employment. Because we do believe that they deserve to be in the community. They should be gainfully employed. Our next focus with them is housing. We have a lot of people who are living with aging parents. And if the parents were to pass, we have to find a solution for what are we going to do with housing. We don't want to institutionalize them again, and we don't want them homeless. So we do need to work with some solutions for what do we do to keep them housed in our community and keep them with that inclusion concept going. Michael and Ron probably went over some funding, some additional funding that they got. I am on the statewide performance measures committee that the legislature created around House Bill 1277. That's another document recording fee that is going to be towards rental assistance and permanent supportive housing. And they are looking at performance measures with a strong focus on diversity, equity, inclusion, ensuring that communities of color are getting served, because the data shows we are not reaching many of those communities across this state. And they have higher levels of poverty and homelessness when you dig into the data. So I have been participating on that. They are about to roll out the plans to the counties of what that looks like, and some real good, strong indicators of outcomes, particularly as you work with the communities of color, but also wanting to know how can we look at permanent supportive housing models. How can we use the funding differently to wrap around services for that? Because you can't just house people. You need some services attached to that housing. And then for behavioral health, I have been working with our department's units, behavioral health and the homeless CHAD unit, to look at some integration of care, because one of the populations that we really need to target better is people with drug and alcohol and mental health challenges who are homeless and on the street. And so we want to connect these two systems. These are very different systems in how they're funded and operated. But it's really talking about 3 systems. You're talking about housing, you're talking about homeless, and you're talking about behavioral health. And then if you want to throw medical care in there, you can. And so we want to look at what can we do to do a more robust integrated system to better help those people. Because a lot of times you can't just put them in a shelter. That doesn't work. They're very destructive. And our homeless providers are not necessarily equipped for how to help somebody who is high on drugs or intoxicated or who is in a psychiatric or psychotic breakdown. So we want to work with the behavioral health provider. So we're getting 2 new positions. One is in Michael's unit to kind of help him kind of with the homeless system, He has been taking on a huge load along with Rebecca and Beth, but the workload has increased, funding has increased, which is a good thing, but we need a little bit more assistance in that area. The other position is going to be in the behavioral health unit. That is going to be a crossover between behavioral health and homeless to kind of work with providers around looking at best practices, looking at how do you get these systems to work together, looking at funding mechanisms, working with the 3 state agencies that are involved, Department of Social Health Services, Healthcare Authority, Department of Commerce, that are all involved in all of these different areas. Department of Commerce has a new Healthy Home division that Melody Payzalt is now leading. And if any of you know her, Melody used to work in community services. And so we are going to need to be prepared for what does that look like? Because some changes did happen with the legislative session. I think it was last year, but they've been working on it for a number of sessions this year. So we need to be ahead. If anybody knows me, I'm all about getting ahead of change and not letting change lead us. We are one of the innovators, Clark County is in the state. So we tend to be one of the first coming out the gate with pilots or trying to do some things differently. We do use our data to look at where the need is, and we're very clear about performance outcomes. So I just want to make sure that all across our departments, that is our focus and our emphasis. That leads us into the strategic plan. It's time for us to renew the strategic plan. You guys will have a chance to kind of get updates and be a part of that because you guys will need to support it before it goes to the Department of Commerce. But it's not just for community action. I'm going to do it department-wide like I did before, because as you can see, it makes no sense to do a strategic plan for one program. So we need to do department-wide. So the focus this year is going to be, we've hired a consultant named Jackie St. Louis. He is a licensed mental health therapist, but he also has extensive background in working with homeless and prison populations. And so and he also does some DEI work. We're going to be working with him. We have a committee, the strategic planning committee that will be within the department. Rebecca and Michael are a part of that. And we will be working very closely with all staff. Last strategic plan was staff-led. We will continue to have staff be engaged, and we will work to see how we can include all of our advisory boards, because we have about 7 of them in our department that work with us. So we will see how we can get some feedback from all 7 of those advisory boards into that process. We will have a strong focus on diversity, equity, and inclusion, making sure that we use data and making sure that we are serving everybody in this community to make sure we're serving the LGBTQ+ and also the communities of color and people with disabilities. And that includes mental health, behavioral health, physical health, intellectual disabilities, blind, age, disabled, whatever the disability is. We want to make sure that we are addressing those needs. We want to make sure we are reaching out to the diverse communities, the communities of color. We also want to make sure that we are using the data. So as you have probably seen the community needs assessment that Rebecca and then worked on, we will be using that data. Some of the other programs have some data. You saw the race equity report that Council for the Homeless did. We will also be using that. And then Rebecca and them are looking at updating the community needs assessment to make sure we have an equity lens in that focus. Our first and foremost goal is to make sure we are helping the populations who need it, and our goal is to help them thrive. We don't have entitlement programs. We have programs to help people improve their lives. And there are, again, strong outcomes attached to each of our funding sources. One of the things I also want to make sure is I want to take a different approach this year. As you can see from the PowerPoint or the one-pager, our funding tends to silo how our department operates. So you have developmental disabilities, you have the CHAD unit, you have behavioral health, and then you have the business unit, which is kind of the support for all those programs. One of the things I want to do, and I got this, I can't take credit for this. This is actually coming from a gentleman who lives in Grays Harbor, who is actually doing some very innovative, creative stuff around helping the homeless move into housing and wraparound services. And so I've been meeting with him and watching their program at Coastal Community Action Program. They're another CAAB agency. And one of the things, as he's talked to our staff and come down here and visited our providers, and actually went out and talked to some people that are on the streets right now and getting some input, he basically said, you know, you're not going to be successful until you put the people or the families in the middle and surround your fundings around them and find a way to do that. He says, if you continue to just operate like, here's the hand, or here's the document recording fees, or here's your behavioral health, he said, you will continue to keep getting the same outcomes. And he said, you're doing good, but we could be doing better. So I want our staff to have that focus as we go into this next strategic plan. Now, we know we won't go there, get there, you know, the first round, but it is our first attempt at that. And we will continue to move and improve on that focus. I will ask the managers, whatever comes out of the strategic plan, their performance goals that are in their evaluation to be strongly aligned to that strategic plan, as will be mine. And mine will also be aligned to the county's strategic focus. So that's kind of what our priorities are for 2023 as we kind of continue to move forward. I just wanted to see if anybody had any questions for me about any of the handouts or anything I just talked about.
I have a question from David. I am the deaf community representative. I would love to talk with you sometime, Vanessa, about the data that we have on the deaf community to make sure that you are able to provide your services as best as you can for those people, please.
Absolutely. Absolutely. Michael and them can give you my contact, and yeah, definitely would love to see that, what that data looks like.
Perfect. Because I have some data that I think that you may be interested in.
Thank you.
This is Alicia. Vanessa, I just want to say thank you for taking the time this morning. Your CAAB board ran very well, and Rebecca and the team is doing a phenomenal job. So thank you.
Thank you. Thank you. Thank you for them compliments. Well, if there's no other questions, I just want to thank you all. As we continue to move forward, you know, we have a new county council coming in. One thing that we do is we have a PowerPoint that kind of gives a high-level overview of our department. We're working on updating that. And then we will meet with each of the different county councils members to kind of educate them as to what our department does. And so I just want to, again, thank you for being members of the Community Action Advisory Board and giving up your time. And really kind of helping and rolling up your sleeves and helping to do good in our community. So thank you. Thank you.
Great. Thank you so much. Appreciate your time. All right, we'll move on to Michael to talk about homeless document recording fees.
Hey, good morning, everyone. Michael Torres, Clark County Community Services. And what we are going to, Rebecca, would you mind backing up to the initial slide before we just, thank you so much. So first I wanted to talk about what it is this presentation is about. It's called document recording fees. These are fees that are locally collected here in Clark County when real estate transaction documents are recorded. That's the standard recording fee is about $203. And there are variations depending on what kind of document you are recording, what the transaction, you know, is about, if you're doing a plat, if it's for condos, things like that. But those funds go, part of them remain here in the county, and part of them go to the state and eventually come back to the county. These fees were created by state legislation. They were not created by local legislation for the purpose of funding affordable housing and homeless activities in the counties. So in a lot of the conversations that have happened over the past, I don't know, since I've been here, you know, the past 7-8 years, you hear a lot about document recording fees. And there's not a lot in those discussions about what those fees actually are. What is the legislation that created them and governs how the fees, how these funds are used and why? So what we're going to do in this presentation is kind of hopefully help you as a CAAB board member understand what document recording fees are, know what is the legislation that is behind them, and lay eyes on that legislation, so just so like we're like, this is what it does. And then you look, yes, that's what it does. Get the links, or have access to the links that can take you to the legislation, to the document recording fee information, things like that, and that you understand the basic setup. That's the purpose of this. This is not a presentation where we're going to be discussing how the fees are used or policy things around the fees. This is just a very basic explanation about what is the legislation, what are the fees, how is that implemented locally, just so you have that starting point from a position of knowledge, if that makes sense. Next slide, please. No worries, we're getting there. Okay, so let's start with the types of the document recording fees. And because, people say document recording fees, and they think that it's all one thing and it's all the same. And the reality is there are really two different kinds of document recording fees. You may hear them as House Bill 2060, House Bill 1359, 2163. Probably a better way of referring to them, because there are also little modifications that have been done over time for, like, if the fees originally they were going to sunset, like the fees have changed and what proportion is collected for what. So the actual House bill numbers have changed a little bit, but the original ones were House Bill 2060 and then 1359, 2163. But a better way to think of them is by the title of the legislation that created them. So House Bill 2060, that fee was established by RCW 3622.178, and it's known as the Affordable Housing for All surcharge. It is the smallest part of document recording fees. Approximately 1/5 of all the document recording fees are these House Bill 2060's Affordable Housing for All surcharge.
Michael, can you repeat what that RCW was? 36?
It's right there.
It's
Right there,
36.
22. Got it. Okay, sorry.
Yeah, decimal 22, decimal 178, and we will look at that in a moment, Alicia, just so you know. It's like we will look at that RCW and see what it says. So that's known as the Affordable Housing for All surcharge. It's actually the smallest part of document recording fees that are out there. Ironically, it is the document recording fee that, when we're talking in the community, kind of gets conflated with everything else. It is the only part of document recording fees that require an interlocal between the county and the cities. This 1/5, the state estimates is between 1/5 and 15% of the total document recording fees collected are in this Affordable Housing for All surcharge. The requirement for an interlocal between the county and the cities is specified in that legislation, the 36.22.178. The allowable uses for this funding is to create brick and mortar housing for people who are low income, meaning 50% of the area median income or below. They can be used for rent vouchers for the same eligible population, or they can be used for emergency shelter operations. There is no mechanism in the legislation for this portion of the document recording fees, is Affordable Housing for All surcharges, for a city to claim their own portion independent from the interlocal. The legislation states that these Affordable Housing for All funds go to the county for the county to use them as agreed upon in the interlocal for those allowable uses, that brick and mortar, that rent vouchers, the emergency shelter operations. That's affordable housing for all surcharge. And I will show you, I think it's slide 35, we actually I'll show you the collections, how much is that, that kind of stuff. So the majority of the document recording fees. So again, this House Bill 2060, this affordable housing for all surcharge. When you hear discussions of interlocal, and I think a couple of meetings ago in the CAAB, I heard someone ask, what is an interlocal agreement? Basically, it is a contract between public agencies, between local government for services. That's what it is. In this case, the interlocal is the agreement between the county and the cities in the area on how we are going to use these funds. So that's House Bill 2060, House Bill 1359, House Bill 2163. That's that majority of the document recording fees. These are the fees that actually fund the homeless services, like the local document recording fees that go into the homeless services. Most of our homeless services, case management, rent assistance, permanent supportive housing, rapid rehousing, things like that, are actually these fees. This majority is 4/5 of the total document recording fees that are collected. This fee was established by RCW 36.22.179, and it's known as the Local Housing and Assistance Surcharge. These fees are not covered by an interlocal. They're not required in legislation to be covered by an interlocal. By legislation, these fees go to the local government that has a homeless plan. And the purpose of these fees are for that local government to operate their local homeless plan. Any city can claim their portion of these fees by formally asserting, passing their own resolution, communicating to the state and communicating to the county that they are asserting responsibility for homeless housing within their own borders and adopting their own homeless plan. That's when they can get those fees. And any city at any point in time is welcome to do that. So again, those are the two kinds of document recording fees that exist. The smaller portion is for brick and mortar and emergency shelter operations. It always goes to the county by legislation. The legislation requires an interlocal. There's no mechanism for the cities to claim their own portion of that. And they are operated, those funds are expended as agreed upon in an interlocal. And we'll look at our interlocal agreements in a moment here as well. The other portion of the fees go to the local government that has asserted responsibility and created a homeless action plan. And those fees go to implement, basically, the homeless action plan. Next slide, please. So this is just, if you go, and you'll have the links at the end of this presentation, but if you go to RCW 36.22.178, that affordable housing for all surcharge, that smaller portion of the fees, this is what the legislation actually looks like. This is the legislation, a screenshot from it. The highlighted part tells you what I put in bulleted section in the last slide, which basically these funds go to the county. They will be they will be utilized for the following purposes. These brick and mortar, emergency shelter operations, in accordance with an interlocal agreement between the counties and the cities within the county. And that interlocal agreement needs to be consistent with local housing needs and policies, countywide and local housing needs and policies. Next slide, please. For RCW 36.22.179, the majority portion of those document recording fees, that surcharge for local homeless housing assistance, again, this is the legislation itself. It it says what I had bulletized in that first slide, which basically states that these funds are used to accomplish the goals of the local homeless housing plan, what we call the homeless action plan, unless a city in the county has decided to operate their own local housing program. Next slide, please. So if you go, and you will have the link at the end of this presentation. I have a slide with all the links. If you go to the Washington State Legislature, and you can go and look up, these legislations, and on your own and look it up. This is the 43.185C, and this is going to get into the legislation that governs what homeless funding goes to who and what it's used for, and we'll get to that in just a moment. But that's what that page looks like. Next slide, please. 43.185C.050 talks about local homeless housing plans. And this legislation requires local governments to develop and establish a 5-year homeless housing plan for its jurisdictional area. That's what we call the Homeless Action Plan. It requires that these local plans be consistent with the State Department of Commerce guidelines for those plans. It also requires that these local plans be aligned with the State Department of Commerce 5-year homeless housing strategic plan. So, and the plans must be aimed at eliminating homelessness by housing the unhoused. It cannot be a plan that's limited to sheltering people, or that is limited to outreach efforts. It has to be a plan that includes the spectrum of services that will take someone from being unhoused to being permanently housed. That is a legislated requirement of the homeless action of your homeless housing plans. And interestingly, it's not prohibited, but in terms of the eligible activities of the plans listed in the legislation, it actually doesn't mention shelter, which is probably one of the reasons that the House Bill 2060, that Affordable Housing for All plan, does include funding of shelter as one of their primary allowable activities. Next slide, please. And that's what this legislation looks like, the 43.185C.050 on local homeless housing plan. So it lists out, what the eligible activities are, those which does not actually list shelter in there. It talks about the requirements for the plan, the local homeless plans to be aligned with the state, to follow state guidelines, et cetera. The things that I listed in the earlier slide and bulletized. Next slide, please. So there is a state strategic plan that our local plan needs to be aligned with. If we go, and you'll have this link, just like everything else, you can go to the state websites and look up their state strategic plan for housing homeless people. And you can look up their local plan guidance, et cetera. Next slide, please. In local plan guidance, the state says, and this is State Department of Commerce guidelines based on that legislation, that 143 Charlie legislation. Required planning objectives of your local plan have to include quickly identifying and engaging all people experiencing homelessness under the state definition, and all unaccompanied youth under any federal definition, through outreach and coordination between every system that encounters people experiencing homelessness. So that is a requirement for our local plans, which translates to how we implement those local plans with those document recording fees. So it's telling us that we have to have efforts to see and understand and identify who's experiencing homelessness. It's telling us that we must use the state and federal definitions for homelessness. We cannot just create our own local thing. And it's telling us that there has to be an outreach and coordination process between the different services and systems that touches people experiencing homelessness. This is one of the reasons that Vanessa has really been asking our department to focus on a lot this year in the coordination between the homeless system and the behavioral health system. Because we do know we need to improve coordination to close gaps in services for people who need those services. The second objective is to prioritize housing for people with the greatest need. So this objective tells us that our local plan and how we implement it, it has to have some kind of process to assess need, which basically turns into a common assessment process of all our services. We need to be able to do triage. This is what drives our requirement to have coordinated entry, to have assessment tools, things like that. So this is, coming from state legislation to state guidance to us in terms of how we craft our plan and implement it. Another objective is that we have to operate an effective and efficient homeless crisis response system that swiftly moves people into stable permanent housing. So what this means in actuality, is that we don't only fund single programs. We have to fund and operate a system, a continuum of care, so to speak, for people who are experiencing homelessness. So this is why in all our county contracts that involve what we call the homeless crisis response system, we require using coordinated entry. We require service providers to use the homeless management information system and enter their demographic, their service, their outcome data in HMIS so that we can track those things systemically, holistically, see the outcomes, stuff like that. So that's a state requirement. Objective 4 is to project the impact of our implemented local plan on the number of households that are housed and number of households left and sheltered, assuming existing resources and state policies. We do not get enough resources to end homelessness for everyone in the county. It would be great if we did. So we need to be able to have an estimate that within the period of our local plan, within this 5-year period, how many people are we expecting it will be served? What will be the gaps that happen? So a lot of what happens in our local homeless action planning process is trying to figure out those estimates. The State Department of Commerce does provide us with some models on how to do that, and they're provided as appendixes usually in our local plan, and we report that to Commerce as well. And then the last objective, that is the last primary objective that is required by the state for our local homeless plans. Again, all of this stemming from those legislations that I talked about earlier, is objective 5 is address racial disparities among people experiencing homelessness. And I'm not saying this out of opinion. I'm saying this from a position of knowledge of data. We do have racial disparities locally in terms of people that are experiencing poverty, people that are experiencing homelessness, people that are needing and accessing homeless services, and what those outcomes to the services are. We really started looking at this very carefully and pretty intensely in 2018 is when we really started tracking the disparities. And that's the first year that we got Council for the Homeless. And I say we got, like, we worked with Council for the Homeless to publish. Council for the Homeless is very willing to do this. The local equity plan. I mean, the system equity report, the annual equity report that we publish every year. And I can tell you that between 2018 and 2022, we've made a lot of progress in addressing some of those disparities. The reality remains that if you are Black, Indigenous, or a person of color, you are a lot more likely to be experiencing poverty, you know, in terms of, like, statistically proportionality. There's a disproportionate representation of BIPOC persons who are experiencing poverty in our community. There is a disproportionate overrepresentation of BIPOC persons who are experiencing homelessness. Those populations, those BIPOC populations, are underrepresented among those that are receiving our homeless services. And the outcomes, you know, I'm generalizing here with broad strokes, is based on the data that we see. The outcomes have been better for for white people than they have been for BIPOC. So the services that we provide culturally have been more tailored to the white population that is experiencing homelessness, as opposed to the BIPOC population. And we've been working to address that, and we have been making progresses. So we do have some interventions right now where the gaps between that disproportionality of outcomes and services has been rapidly closing. But we also do have interventions. For example, permanent supportive housing has a very strong representation, a strong underrepresentation of the BIPOC population that needs those services, you know, in PSH programs, the permanent supportive housing programs. So we're working on that. Next slide, please. So if we go to the state website and we look up local plan guidelines, you know, it's posted on the website. You can access what the state guidelines are for local plans, and that's the intent of this slide. Next slide, please. If you can go and look up the state strategic plan, the homeless housing strategic plan that our local plans need to be aligned with. You know, they cannot work in opposition to the state strategic plan. If you have been listening to the most recent ECHO meeting, the Ending Community Homelessness meeting that the county council and the city of Vancouver and other city councilors have to discuss homeless issues, you may have heard Vanessa and me state that we were putting a pause on our current homeless action plan update activities, because we had just received notice that the state is making a major revision to this plan, which our local plan is supposed to be aligned with. And the state has recommended that we wait on the publishing of the state plan before we update ours, to make sure that we stay in alignment. That is why. So this is the plan that is actually being significantly revised. And again, all of this stems from the legislation that governs plans and local plans, which brings on the funding for that, which is 43.185 Charlie .040. Next slide, please. So we do have, even though we're in the process, you know, like it's on pause, the update of it, but we do have a current and existing homeless action plan. It was created 2019 to 2022. It will really be extended through 2023 until we publish a new one. It is publicly available. It's on the Council for the Homeless website. It's under the About Homelessness tab. But you know, you will also have a link at the end of this presentation. Next slide, please. So the portion of the legislation that talks about what entity receives what homeless funding from the state is RCW 43.185 Charlie decimal 080. It governs who receives the document recording fees for homeless funding, and it governs who receives other state homeless funding. So things like the Consolidated Homelessness Grant, things like the governor's shelter program grant. That was special funding. It might be extended and become permanent, but it came out during the pandemic. So any state designated funding for homelessness, not anyone is eligible. This is the legislation that says what entities are eligible. This legislation requires funding that is designated for homelessness to go to a local government. It makes the counties the default recipient of this funding. It states that cities can receive their portion of document recording fees, that 2060, 2163 funds, that homeless housing funding that I spoke of at the beginning, and also be eligible for other state funding by asserting responsibility for homeless housing within its own borders and notifying the county of its intention and commitment to operate a separate housing program. The legislation also states that cities that assert this responsibility must adopt their own homeless plan, and that plan must meet the same state requirements that the county must meet. And it does not apply to that Affordable Housing for All House Bill 2060 funding. Next slide, please. So this is the legislation itself, what it looks like. The highlighted parts, are basically have, state the bulletized format from the last slide. Next slide, please. So I want to touch base on the interlocal agreements that we have on the House Bill 2060 funds. The reason I want to touch base on this is because in a lot of meetings, like in the ECHO and stuff like that, in meetings within the CAAB, when we're talking about document recording fees, like the interlocal covering, like governing how document recording fees is, like that statement is often made. It only actually governs this small portion of document recording fees. This is the interlocal requirement established by that RCW 36.22.178, the legislation that established the funds. What you have highlighted in front of you is the only portion of legislation that talks about the interlocal. It says the portion of the surcharge retained by a county shall be allocated to eligible housing activities that serve extremely low and very low income households. So that means 50% AMI and below. That's when you say extremely low, that's 50% AMI and below, and very low, 30% AMI. Correction, opposite. Very low is 50% AMI and below. Extremely low is 30% AMI and below. In the counties and cities within a county, according to the interlocal agreement. So it says we're going to be using the funds as allowed by and intended by the legislation and agreed upon between the county and the cities within the county. So there are two interlocals that exist right now that apply to these funds. There is an interlocal that was modified and signed by the City of Vancouver and Clark County, which expired. So when you hear about an expired interlocal agreement for the House Bill 2060 funds, it's specific to the City of Vancouver. And there is an interlocal that's signed by Clark County, Battleground, Camas, La Center, Ridgefield, Washougal, Woodland, and Yakult, which is in effect until January 31st, 2026. The interlocals, actually, next slide, please. I'll cover this in a moment. So I was just going to say the differences between the two interlocals. The interlocal with the City of Vancouver, which is expired in January 31st, 2020. It focuses the agreement in the interlocal in terms of how the funds are used. It agrees to focus the expenditures on shelters. It establishes the Community Action Advisory Board as the entity that administers the fund. This is the reason, besides being the reason that we're holding this training, This is the reason that the CAAB receives, reviews, and scores the proposals that the county gets for our homeless funding. It's the reason we provide you our expenditure and revenue reports in all our reports. So, that's how you're administering the fund. It requires, oh, go ahead.
Do you want questions during your presentation or after?
I'm happy for questions during the presentation. Please go ahead.
Okay, so if the City of Vancouver interlocal is the reason that this board reviews the applications and makes recommendations for funding, if the City of Vancouver doesn't renew their interlocal and chooses to have a resolution to designate their own funding, would that task go away for this board?
Well, no, no, there's nothing in the legislation that states that this is something that the county has implemented. We just as a general process, we believe it's a good practice to have a citizen advisory board and a transparent public process involvement. So we actually use this same model, Alicia, for all our funds. So like the reality is the CAAB does not only review the proposals for House Bill 2060 funds, we actually bring, even though it's not required by the interlocal, we bring House Bill 2060 funds, 1359 funds, and 2163 funds, all the document recording fees to the CAAB. That's not required by the interlocal. We do it anyway. We provide all the reports, the same way we do. We also, for other funding sources, we do the same with the community action funds, even though it makes more sense. There's a direct tie between Community Action Advisory Board and the Community Services Block Grant funds, but we follow that same process. And we follow a parallel process, not with the CAAB, but having the same kind of model of a advisory board, a board of either citizen representatives or elected representatives with the Urban County Policy Board that we use for our community development block grant funds and our home investment partnership funds. It's a practice that we believe in. We think it's a good practice, and in terms of public transparency, public stewardship of funds, and due diligence, is good to do. And the other thing is, even though that interlocal with the City of Vancouver is expired, we have that same process with the interlocal with all our other cities, which is in effect. So we wouldn't, unless, we would not move to change that general process, and I haven't seen, we've not received any feedback from any entity, including the City of Vancouver, that that's a desire, at this point. Like that, any conversations we've had about interlocal agreements that at least that I'm aware of have never involved, why is the CAAB involved in this? We want that to change, stuff like that.
Okay, thank you so much for that.
Sure. So, the interlocal with the city that expired, it focused expenditures on shelters. It establishes the CAAB as the entity that administers the fund. It requires annual reports on receipts of these 2060 affordable housing for all funds. What is the county getting? And on the expenditures and projects agencies that have been assisted with the funds. And the interlocal talks about an equal distribution of funds upon a party withdrawal of the interlocal. Now, there's no mechanism to allow that in the legislation that established a fund or that requires an interlocal. Like the legislation just states point blank, it goes to the county to be used in this way. So I don't, this is not criticism of the city or any city, just factually, the interlocal is supposed to be one interlocal agreement with all the cities. And this got signed like shortly before I even came to the county. So there was the interlocal agreement that went out is the same interlocal agreement that went out to all the cities. What came back signed and what got signed by the City of Vancouver and what got signed by the county manager from the city of Vancouver was an edited version of what was sent out. And myself, community services, we don't know what the process or what agreements were between the county manager at the time and the city manager at the time, to sign those things. All we know is what was signed. But that's the reason there are 2 interlocals, and the differences between the city of Vancouver interlocal and other city interlocals are very minor. And I'm going to go over that in a moment. So the interlocal with the other cities, one difference is the expiration date. With every other city, the interlocal expires 2026. The interlocal with the other cities also focuses the expenditures of these House Bill 2060 Affordable Housing for All funds on shelters. It also establishes the Community Action Advisory Board as the entity that administers the fund. It requires an annual report on expenditures and project agencies assisted with the funds. So the edits that were made, that there's a change in the numbering, and you'll look at interlocals in a moment, or parts of interlocals in a moment. The edits that were made by the city of Vancouver, the changes were really the expiration date, requiring a report on the receipts and expenditures. So the receipts were added. And what was also added was talking about an equal distribution of funds upon a withdrawal of the interlocal, which I don't think we could do based on existing legislation. But those are the differences between the 2 interlocal agreements. Any questions on that? Okay, next slide, please.
Yes, I do, David does.
Oh, go ahead.
The last thing you said, I didn't really understand. We were talking about the city of Vancouver, and currently the law and legislature wouldn't really allow them. It wasn't receipts, it was something else. I didn't understand that last thing. They were requesting something, and I didn't understand what you were saying.
Oh, the one of the edits in the interlocal that was signed between the county and the city of Vancouver. I mean, basically, it's an interlocal that's identical to the interlocal that's signed with the rest of the cities. With 3 differences: the expiration date, that it requires an annual reports on receipts and expenditures, not just expenditures, and it also talks about an equal distribution of funds if a party withdraws from the interlocal. And what I was saying is the legislation that established this funding and that requires the interlocal does not provide any mechanism for that to happen. The legislation explicitly states the funding goes to the county to be used in this way for these allowable purposes. So honestly, if any city said, hey, we don't want to participate in your local, give us our portion of the funds, I guess that would be up to the attorneys, our councils to decide if they could or not. It would be contrary to the legislation that established the funds. That's all I know. And it's not, again, this interlocal only applies to this small portion, this 1/5, between 15% of the total document recording fee funding and the small portion of funding. Again, for the House Bill 2163 and 1359 document recording fees, the fees that are intended to be used to implement and operate local governments' homeless action plans, any city could receive their portion of that majority of document recording fee funding. They would have to assert responsibility for housing homeless within their borders and create and operate their own homeless action plan, which met the requirements of the state to do that. Does that answer your question?
I think so. I think what I understand you're saying is what they had in this agreement with the city of Vancouver was something that there's no mechanism in place to do this, and they'd have to, if they actually wanted to do this, not saying they would do this, but if they wanted to withdraw from the agreement with the county for the interlocal, the city of Vancouver would have had to maybe have the lawyers discuss it to try to get their funding to go, their share of funding to go to the city. But what we have right now in law is the money is sent to the county, And if they make the inter agreement that they're going to take responsibility to do something, then they might be given a share. Am I understanding correctly?
Kind of. I mean, there's a little bit there that that you're mixing the other funds, but basically, yes. Yes. So I think you're there. I think I answered your question.
For the interest of time, Michael and David, I'm happy to have a conversation with you after the meeting to answer any more details about
Yep.
that question.
Next slide, please. So just so you lay eyes on it, these are what the interlocals look like. The first part is the interlocal with City of Vancouver. We're almost done. Next slide. So this is the one that we signed with City of Vancouver. Next slide. And that highlighted the parts that I bulletized that are really the relevant parts, administration and CAAB, receipts, expenditures, projects, agencies assisted with the fund, the period of, like the applicable part of the interlocal, how long is when it expires. Next slide, please. And the signatures, between the City of Vancouver and Clark County. Next slide, please. And this is the interlocal that was signed by everyone else. Next slide, please. Next slide. The numbering is a little bit different because, like, the City of Vancouver interlocal was edited, but the substance is generally the same, and that's what it's highlighting. Next slide, please. And this expires on January 31st, 2026. And then the next slides are just like the signatures between all the different cities in the county. So like we go Yakult, Battleground, Ridgefield, etc. Next slide. So reporting, all funding reports are submitted to the CAAB semi-annually and at the end of the year. So we do that May and November. You've been getting these reports. Program performance reports, even though they're not required by any interlocal agreement, stuff like that, we provide program performance reports to the CAAB on a quarterly basis. All reports for all the funding sources, all the programs funded are published and available to the public on the CAAB website. Next slide, please. And this is the CAAB website. There'll be a link at the end. You'll be able to see it. And if you go down to the bottom of that CAAB website page and you look up the agendas, minutes, related documents, you'll find the reports. You can also do searches based on year. Next slide, please. The revenue report, that's what it looks like. So if you're curious in terms of, can you go back one? Like, House Bill 2060, again, it's 1/5, just under $1 million a year. The 2163-1359 comes out to like almost $6 million a year. Right now, that changes a lot with the market because it's document recording fees. Next slide, please. This is what the expense reports look like that you've been getting. We've worked really hard to make them, trying to capture all the questions that we get in terms, so it answers people's question, and we're open to making more changes in the future if necessary. Although we think it's pretty good right now. Next slide, please. And then these are all the links to everything we just talked about. So, and I think that's it. Next slide. Okay.
Thank you so much.
Well, thank you.
Joyce, we have a question.
Yes, on one of the slides, it shows Woodland is part of the local agreement. Is that correct?
Yes, that is correct. There's a small portion of Woodland that is in Clark County. And for that purpose, Woodland is part of that. If the interlocal applies to them, but any funds that we expend are only spent in that portion of Clark County.
And Jamie, you have a question?
Thank you. So I know that there was a lawsuit from the BIA against the state regarding document recording fees. Is that something that you guys are following?
No, I do know there is legislation this next session on streamlining document recording fees because, this is legislation that has existed over the past 20 years or so. So there's a lot of confusion about the how much fee is collected, what portion is going to the state, what portion stays at the county, what portion is affordable housing for all, what portion is homeless services. So there's legislation that is going to definitely be discussed and might get passed to kind of like clean that up some, but there is no discussion that we're aware of in terms of legislative efforts to change the proportions or how the funds are actually administered.
So I think the lawsuit was just about the fact that that these document recording fees go to homeless services at all versus only going to pay for what it costs to collect the fee. I think it was like in November of 2021 is when it was filed. So basically they're asking the state to find some other pot of money to fund these services versus document recording fees.
Yeah, I'm not following it, Jamie, but I also would be really surprised if anything happened out of that.
I have a quick question. This is Melanie. You mentioned the state definition of people experiencing homelessness and then a federal definition of unaccompanied youth. Is the difference there just unaccompanied youth are not in the custody of a guardian or custodial guardian? Or is there a difference between federal and state definition of youth that are experiencing homelessness?
Well, no, there isn't a difference between the state and federal definition for youth. There is a difference between the state and federal definitions for homelessness, and the state definitions are more permissive for couch surfing, than the federal definitions. So,
okay.
And again, though, remember that part of the requirements are we need to prioritize based on need, based on vulnerability. So I can tell you right now, like, definitions are not the problem. Definitions are not why people don't get served. It's demand versus resource, and the fact that we have to triage.
Thanks for that clarification.
Sure.
All right, I think we better move on to Rebecca's presentation. Thank you so much for your time and that thorough overview. It's very interesting because we hear that term a lot, so it's interesting to do a deep dive. Rebecca, I'll turn it over to you for the Roma overview.
Great, thank you so very much. So I wanted to give an overview of what Roma is. So Roma is results-oriented management and accountability for the board. This is what kind of governs a lot of the work that we do as a community action agency around the contracting, and is a component of the organizational standards. And I'm kind of going to go through kind of some history and how Roma came to be, along with community action agencies. What is Roma? Roma is results-oriented management and accountability. It's sometimes agencies will talk about their Roma report or about the Roma program. I'm actually a nationally certified Roma instructor, which is a specific certification, which means I can go around and train other people or train people on Roma and the concepts regarding Roma throughout community action. But wanting to keep in mind that Roma is a complete management and accountability process that's focused on the results achieved due to the agency's activities. So we take a look at everything and we implement Roma throughout all of the work that we do, including the needs assessment, the strategic plan, the quarterly reports with agencies, our contracting. Really, the concepts are all integrated into the work that we do. So this is the Roma cycle. It's typically starts at the top, but it is a continuous improvement program type model. So you start with an assessment, identifying those needs and resources, then you move into your planning stage. So you're using that assessment data and your agency's mission to identify the results and strategies that you want to move towards. Then you go into that implementation stage and put those strategies and services into practice. Then we start looking at the achievement of those results. So you observe and you report that progress. We do that through our quarterly reporting with our agencies as one kind of component of all of the different things that we do. Then you want to evaluate what you're doing. You're really looking at that data and comparing it with original benchmarks. And then you kind of start that process again. What needs to be adjusted? We do this continuously. We have a larger process with starting with our needs assessment and then the request for application processes that create our outcomes in our programs. We monitor those agencies for meeting those outcomes. We evaluate how they're doing, and then we make adjustments. And we do that annually within the specific programs. But then again, we start that process completely over again when we do the next needs assessment and move back into that request for application. So why do we do Roma? Really, it starts with the history of the Community Action Agency program. So Community Action started back with the Economic Opportunities Act back in 1964, and then it's gone through some reiterations. But then in 1993, Congress passed the Government Performance and Results Act, and really what this said was that they wanted to improve all federal program effectiveness and also include public accountability by promoting a new focus on results, service quality, and customer satisfaction. So that got incorporated into all different federal funding programs, and specifically the Community Action and Community Service Block Grant funds really picked that up and made sure that it was incorporated throughout the programs. Even though this started and affects all organizations, we really see a lot of that happening here with our community action programs. And really the movement is asking what is happening as a result of the federal dollars being used. In 1994, the Office of Community Services, that's where the Community Service Block Grant program is housed at the federal government. They formed the Monitoring and Assessment Task Force, which produced a national strategic plan that endorsed a results-oriented approach for community action agencies. Once they had that strategic plan, they identified 6 national goals representing outcomes being reported across all of the community action agencies. So these were very broad goals that we would be working towards. And it was just really a way for the agencies that are meeting the needs identified in each local community, but being able to understand them at a national level. And so this really was a framework to get that information put together for all of the community action agencies to report to the state and then to the federal government and have an understanding of what really the work is happening at the local level. So this started, these 6 goals, there were family level goals, there are community level goals, and there's agency level goals that were created that we really focus our reports in. However, this changed recently, and also I'm not going to go too much over this slide, and we'll talk more about it in just a moment. The CSBG Act was then amended in 1998, mandating the implementation of a comprehensive performance-based management system across the entire community services network. And this is really where ROMA started. Our results-oriented management and accountability structure or framework was created that we are using today. And what happened was it created a required performance reporting for all community service block grant recipients or community action agencies. And that new reporting started in October of 2001. And this is one of the first federal programs that actually required more comprehensive reporting. So the Roma definition is that it's a sound management practice that incorporates the use of outcomes or results into the administration, management, and operation of community action agencies. And this is really important because now we are talking about outcomes and the change that happens, and not just the implementation of services into the community. In 2017, there was an update that occurred for the CSBG Performance Management Framework. It's also known as Roma Next Generation, a reimagining of how Roma is implemented into our community action agencies and how we do our reporting. During this process, or was developed through this process, known as the theory of change. And instead of having those 6 different goals, the theory of change model changed and created 3 national goals instead of the previous 6, basically incorporating all 6 of them, but really into 3 goals. The Community Service Block Grant Performance Management Framework has some very specific components to it. It includes the local organizational standards. We talked about that yesterday, and those are those administration requirements for doing the work of community action to make sure that we are being accountable and reporting out the work that we're doing. Includes state and federal accountability measures. It incorporates the results-oriented management and accountability, or ROMA, principles. There's also a community services block grant state plan that's a part of the framework. There's the local agencies community services block grant annual report that we do and submit annually. And then there's also this ACSI survey that is also completed by all of the community action agencies. So this is a model, the theory of change model. So you can see those goals across the top. So goal 1, individuals and families with low incomes are stable and achieve economic security. Goal 2 is for communities where people with low incomes live are healthy and offer economic opportunity. And then we also have goal 3, where people with low incomes are engaged and active in building opportunities in communities. So goal 1 is really talking about the services and really promoting self-sufficiency for our communities. Goal 2 is really working at the agency and community level and the things that we can do to improve the community itself, not focused on individual families. And then goal 3 is really wanting to work on getting people engaged with activities and community action organizations in their communities, which provides some additional context and framework for them to promote self-sufficiency. These can be done through services and strategies. A lot of times you'll see in our reporting, in our community needs survey is based off of these services and strategies. So you can see those: employment, education and cognitive development, income, infrastructure and asset building, housing, health and social behavioral development, civic engagement. Those are all areas that we talk about in our needs assessment and incorporate in the survey of needs. There's some core principles that we work towards through this theory of change. And then it talks also about that performance management and asking those questions and making sure that we are meeting the performance management mandated by the framework and also the organizational standards. So our community action agency we must focus on the results of the program. So we can't focus on outputs. What we need to also include those outcomes. And then results can be at that individual and family level, at the agency level, or at the community level. So we really want to look at the system itself. So the work that we're doing with our nonprofit agencies that are doing work in the community, helping individual households, that's at that individual family level. The work that we do with our strategic planning, with the needs assessment, with partnering with other programs, with other funding sources, that's really at our agency, and then moving into that community level, looking at the entire system. So what's been measured in the past, before we really went into Roma, a lot of the focus was on services and outputs. And that would be, you know, the number of food baskets that were distributed, Meals on Wheels, children attending Head Start, you know, really participation activities or giving things to people, but not really focused on what happens when we do those services in the community. So now we want to, or a little bit more about those outputs. We don't want to just look at the output itself, but we want to see where those results are. So the big question that we ask is what changed because of these interventions? And that's where our outcomes come in place. So we do those inputs, so those little small services that we, the inputs will be like our households, right? And then we go into the outputs, which is the services that we're providing. But then what that change happens for that household and then moving towards self-sufficiency, removing barriers to stability, those things, those are what we consider our outcomes. And that's that change that happened. So again, the outputs tend to be more service focused versus the outcomes, which is that real change. One thing that to really note is that community action agencies are really unique. Each one operates differently. We are a public community action agency that does not do direct service, where the majority of the community action agencies across the nation are nonprofit organizations doing direct service. And then there are quite a few public agencies, but they also do direct service through their office. We work with our nonprofit and community-based organizations to perform the services within the community. So we do operate quite a bit different and are more unique of a community action agency. Community action agencies are also known as change agents. We're not just service providers. We want to look for that change. We focus on the transition to self-sufficiency. We have that these outcomes identified in all of the programs that we fund and the contracts that we have in the community to really focus our agencies and the nonprofit partners to look for where they can make change versus just providing services. And community action helps people change their lives for the better and communities become better places to live. Those are some core principles of community action agencies across the nation. So why is reporting on services not enough? Well, community members don't care about the process if they don't see that we're getting results. What they care about is changing lives and improving their communities. They want to see what is happening. They don't only reporting on services or, like, for example, the number of food boxes provided is in great data to have, but really how is that helping people become stable and remove barriers and improve their lives? So how will lives change and communities be improved? Before you decide, or before we decide what services and strategies we support, it's important that our agencies, our agency staff, the nonprofit staff and the CAAB understand that what the community needs and the resources are, and that's done through our community needs assessment. The purpose of the CAAB really to bring in all of the different areas of expertise that different board members have to a collective purpose to support and improve the services and the lives of people who are low income in our community. Incorporating the mission of our department, which reflects the work that we do, and then the results that are to be achieved by program activities. And that's where our reporting comes in, so that the board and the nonprofit agencies know what is expected of the different programs. To determine what types of services need to be supported, we start with that community needs assessment. That is really the starting point of understanding what we should be providing in our community. Community action agencies are required to do the community assessment in their communities and to have a local voice from people who are low income to identify what the needs are, what the gaps of services are in our community, so that we can then focus the funding that we have and the programs that we're funding in the community on meeting the needs or the gaps of services that we're seeing. The information that goes into the community needs assessment comes from a variety of sources, but primarily from people who are low income through that survey of needs and through focus groups and community forums to get that information. We also talk with our community partners, the nonprofit partners that are doing the direct service work. So we have an understanding of things that are being seen in the community. And we want to look at the results that we want to achieve based on those needs and gaps that we're seeing. So how do we focus that funding to get those results? And once we have that, then we can identify the areas of services that we're wanting to focus funding, do our request for applications for those specific types of programs. And those are what are put forth to the Community Action Advisory Board to review and then select to put funding into to work towards achieving the needs, meeting the needs of people in our community. So Roma has it's kind of some steps, and it kind of looks at like a pyramid. We're going to start from the bottom of this picture. So again, we're really identifying the needs and resources in that community. We're going to develop our priorities to address those needs. Those are the focused areas of funding in the request for application. Once we have those applications and programs, we're asking those nonprofit organizations to identify what the outcomes are going to be that align with the community needs assessment and the requirements of the request for application that were based on the community needs assessment, so that when you're reviewing those applications, you can make an informed decision to make sure that those applications and those programs are meeting the needs of the needs identified through the community needs assessment. And then we'll fund those programs based on the alignment and the board's review and selection for activities and services in the community. So one of the components that is required for staff is that we have to implement, there's a national performance indicator report that we do. It comes from the Office of Community Services, and it's really a framework for all community action agencies to standardize the system of reporting so that it can go from a local community action agency up to the state and then be combined with thousands of others or 1,000 other community action agencies to go to the federal government for review of knowing what is actually being done at the local level. So this was done through the report that includes national performance indicators. There's hundreds of these indicators that we include, and we actually put those into the quarterly reports that we have with our local community-based organizations and nonprofits. We incorporate that based on the type of program that they have so that we can incorporate that into our annual report. Again, we are really targeting services and results. So in the community services block work plan, this is where we take the programs that we identified out of the request for application process. And then I submit a report or a work plan to Commerce that says these are the different types of programs that we'll be funding. And I need to include the number of services that will be provided, how many people we anticipate serving over the next year, and then what the anticipated number of results that will be achieved by those participants. So we send that up as our work plan to Commerce. They incorporate that in their state work plan. So they're taking the information from each individual community action agency and combining it into the state's plan. There is a lot of focus on performance and analysis of the results. So after the services are provided and the results are documented through the quarterly reports by our nonprofit partners, we complete a report for the state office. This used to be called the NPI report. It's been called actually a few different things over the last several years, but now a new version that was created out of the 2017 change into the system is now called the Community Services Block Annual Report. And this is where we take those national performance indicators and we give the results before in the work plan, we say what we think is going to happen based on the knowledge that we have of the different types of services. And then now we're coming back and we're doing an annual report, a final report that says this is what actually happened. This is a way to evaluate the performance rate and the ability to make those projections about performance. When we work with our community partners, our nonprofit partners for creating their reports, we have all of their goals are documented, and they have an what we call the 80 to 120% rule. We want to make sure that our agencies can project their results between 80% of what they've indicated will be their results to 120%. And anything outside of that, the report requires an explanation of why we didn't meet our targeting for that program. And this can happen for a variety of reasons. It's something just so that we can pay attention to what's going on and help our programs be able to target efficiently, and which will help them with their next request for applications and future applications for other funding. And so we just work with them. And sometimes a pandemic happens and it really throws chaos into the system. And so we work with those agencies to really kind of figure out what's going on. Other times it can be just different economic situations that are happening. When we fund employment programs and our economy hits a swerve, that means that their results may not be what they had anticipated based on the knowledge they had from the years before. So we really do work with the agencies, even when they're outside of that. It's not a penalty. It just means there's technical assistance or an explanation of why they're outside of that targeting. If it's continued outside of that targeting, that's when we really talk about what changes need to happen for those agencies to meet their requirements, or maybe we need to increase what their results are going to be because they're just doing better than they anticipated doing with the program. This does happen a lot with brand new programs, as they're really trying to identify how they operate a program and what their results should be when they don't have a lot of history to put towards that program. So this is just a quick snapshot of what the NPI report looks like. It's you can see in here where it talks about the number of participants being enrolled, the number of participants expected to achieve. That's that whole targeting component, how many actually achieved, and then it provides us a percent. And if we're at 80 to 120%, that's great. Outside of this, we ask that we have some sort of explanation of what's going on. So next, Roma Next Generation, there was two major changes to the Community Service Block Grant Program and the reporting. As I mentioned, we went from the NPI report to the Community Service Block Grant Annual Report. Has a lot of similarities to the program. They also moved to an online system, which is very helpful for us, instead of trying to do an Excel document with all of the information. And then it also included some more involved agency level reporting, talking more about what we're doing as a community action agency at a system level. And then Roma Next Generation really was the implementation of the organizational standards that we've been talking about. There's quite a few principles and practices for CSBG. So the National Association of State Community Service Providers has a standard monitoring principles and practices for all of the agencies, and this kind of goes into that. Because we're running behind on time, I'm not going to go into too much detail here, but it just kind of talks about what happens in monitorings, where they come from as far as the states coming in to do monitoring of our programs. As mentioned yesterday, we had a program monitoring this last year for the Community Service Block Grant with no recommendations, no findings. They really appreciated the work and appreciate the work that we are doing here at Clark County for the Community Action Program. And then, you know, as always, a lot of our work that we do ties back to those organizational standards. So this just talks a little bit more about that, and the annual desk review I talked about yesterday that requires a lot of documentation and explanation of how the agency meets each of the standards. And then here are those 9 categories for the different standards that we have. And there's 50 total standards under these 9 categories. And then finally, I just wanted to kind of tie back this Roma cycle in one kind of component of the how we're using the Roma cycle here in Clark County. Again, we use this through our strategic planning. We do it for the actual process of the community needs assessment itself. And through pretty much every component of the work that we do, we implement the Roma principles, those results-oriented management and accountability principles. But here, when we do our work with the CAAB, especially to look for agencies to fund. We start that with that community needs assessment. We do the request for application process based on the results of the needs assessment. We do the contracts with the providers based on the results of the request for application. Then we implement those quarterly and annual reports to really watch for the achievement of those results. And then we compare those results to their contract goals and previous reporting annual reports before we move back into that community needs assessment process again. So the cycle just keeps going over and over again. And that is all I have. Sorry, I know I spoke really fast. I apologize to the interpreters, to David. I'm happy to answer any questions, but I know we want to get into a break. I can answer questions real quick.
I think my mind is kind of processing.
There's quite a bit of information to process. I agree. As always, I'm available by email, and you guys know how to get a hold of me. So if you do think of something later, please don't hesitate to email me, and I will be happy to answer your questions.
So much. Appreciate your time. And with that, we will move into a 15-minute break, and when we come back, we'll be hearing from Council for the Homeless.
Perfect. Thank you, Melanie. And Melanie, your audio is just a little faint.
Okay, I'm going to move back to my desk, so it should be better. Thank you.
Yeah, that sounds good. All right, bye.
Much better. Thank you.
All right, we are joined today by Laura, Cody, and Maddie from Council for the Homeless to provide us with a overview of the homeless crisis response system. So we will turn it over to them and get going. Thank you.
All right, thank you so much, Melanie. Yes, hi everyone. I am Laura Ellsworth, Strategic Partnerships and Advocacy Manager with Council for the Homeless, and my pronouns are she, her, hers. And I'm going to kick us off today. Start off by sharing my screen. Can you all see that? Good? Okay, great. Let's see. Okay, so as we get started, I just want to, before we jump in, I wanted to play this short video about someone y'all may know, and I'm just gonna give it a second here to load up. All right, here we go. So yeah, just thought we could all just kind of ground ourselves and come together and start out with this video this morning. So here we go.
Laura, we don't have audio.
Okay, I heard you say no audio. Well, I'm not sure how on WebEx to fix that. I know we kind of practiced it yesterday, Rebecca, so maybe we'll just go ahead and keep going since I don't want to take up too much time trying to do tech. But if we figure it out by the end, maybe we'll end our day with the video. How does that sound? Can you hear me?
Yes.
Okay, great. Okay, so let's just we'll keep going here. So thanks everyone for having us today. I'm so happy to be here today with you, along with my colleagues Maddie Clems and Cody Shaw. We're going to talk about the homeless crisis response system in Clark County, and so yeah, let's get going. Here's our agenda. We've got a pretty decent amount of time together, and our hope is to provide a comprehensive overview of the homeless crisis response system and to share some data-driven, evidence-based best practices, and to talk about how the Homeless Action Plan informs and guides our efforts, and dig a bit deeper into program and intervention types, and share some stories about our work to prevent and end homelessness in Clark County. So I'm going to get us going today, and then Maddie, my colleague Maddie, will jump in, and then Cody is going to close us out. And we will stop periodically to answer questions, so if you can, please hold your questions for those moments in order to help us stay on schedule. So as we talk about the homeless crisis response system, I just want to emphasize the words crisis response. We like to use this analogy where you can think of homelessness as a sink that's filling with water, and the water represents people already experiencing homelessness, and the faucet flow represents the number and rate of people newly or repeatedly falling into homelessness, and the drain represents how many people are exiting homelessness. And so the homeless crisis response system's role is to address the water in the sink and to try to slow the flow of the water coming in, all the while simultaneously trying to clear the drain so that people can resolve their homelessness as quickly as possible. And unfortunately, the system cannot control things that contribute to a faster stream of water, like skyrocketing rent, minuscule vacancy rates, global pandemics that require social distancing and closures of schools and businesses, and unemployment, among many other things. But what we can do to help clear the drain and help to slow the flow of water coming in through the faucet is to advocate for affordable places for everyone to live, regardless of how much money they make. Connect people to housing programs that work for them by providing the right kind of help at the right time. And truly unprecedented things like the massive amount of rental assistance that went out during COVID, for example, that help to keep people in their homes. It's also important to recognize that the faucet and the drain are very much impacted by other systems like healthcare, education, criminal justice. All of those things influence, the water in the sink and clearing the drain and coming into the faucet besides the homeless crisis response system. So it's all connected. And I'm sure by now that you have all heard of the continuum of care here in Clark County. Among people who are experiencing homelessness, there is a continuum of need and a continuum of service interventions. And along that continuum are folks with low-end temporary needs, going all the way up to those who need permanent assistance for the most critical of needs and vulnerabilities. And all along that continuum, the homeless crisis response system determines need and vulnerability through housing assessments that pair people with the services that they most qualify for. So an effective homeless crisis response system must have specific key elements. Here's another way to look at the continuum of homeless services. Because while my previous slide showed the continuum using a line, as we all know, nothing moves in a straight line when it comes to working with people in crisis. So you'll see each key element here centered around data and planning. And the key elements of any homeless crisis response system are coordinated entry, prevention and diversion, emergency shelter, rapid rehousing, and permanent supportive housing. So let's dig a little bit deeper into each of these elements. Like I mentioned, at the center of everything is data and planning. Clark County, along with all other continuum of care systems in the nation, uses HMIS, or Homeless Management Information System. Yes, it's a wonky name, but it's crucially important, and it's a piece of the system that helps us remain accountable, accurate, and coordinated in our efforts across agencies and across the county. And the data in HMIS also helps determine performance measures, and only gets better as the system increases the number of HMIS users so that the most accurate data is recorded. So the first step for people to resolve homelessness within the homeless crisis response system is engagement with the system. And this is done through coordinated outreach and entry. Coordinated outreach involves outreach workers across many agencies working together to reach people who are living outside and to get them connected to services and engaged in resolving their homelessness by meeting basic needs, entry into emergency shelter and housing assessments to screen for vulnerability, and that determine the most appropriate solutions for each individual. And it's important to note that not everyone gets connected to the homeless crisis response system through coordinated outreach. That's usually only those with very high needs who have been living outside and who've been homeless for a long time. And Clark County recently began using the by name list technique, which involves workers with lived experience from different agencies across the spectrum of demographic expertise working together to meet regularly and to literally discuss people by name to check up on their progress, who they've been connected with, and where they are in their engagement with the system. And by working together in a coordinated and intentional way, we're able to avoid duplication and personalize the work to meet each individual's unique set of challenges. And coordinated entry is also known locally as the housing hotline, which is the single stop point of entry that people can call to begin the process. So we have coordinated outreach and coordinated entry, which is the housing hotline. It used to be that people had to go to several different agencies depending on their issues, repeat their story, repeat any documentation needed, and generally just spend a lot of time going here and there to access services. And we all know that one thing people experiencing homelessness cannot do very easily is go here and there. So by having this single phone number for people to call and coordinating across agencies, a person typically only has to call the housing hotline to begin their entrance into resolving homelessness. So the next key element of a homeless crisis response system is targeted prevention and diversion. And this can take the form of, for example, rental assistance used to help pay back rent for people at risk of being evicted. During the pandemic, our county saw a large increase in federal and state funding to provide rental assistance to people with lost income due to COVID-19. And along with prevention through efforts like rental assistance, there's something known as diversion. And so diversion is for households who tend to have the lowest needs and are able to quickly resolve their homelessness after receiving one-time financial assistance. Thus, they are diverted from the homeless crisis response system and do not need to enter a program to resolve their homelessness. And the next key element is emergency shelter and interim housing. And Maddie's going to talk more in depth about these programs and how people get referred through the housing hotline in just a little bit. But for now, it's just important to know that emergency shelter and interim housing plays an important role in any homeless crisis response system. And there are many kinds of emergency shelter, ranging from shared or congregate shelter, which is usually the picture that comes to mind when people think of emergency shelter. So places like a church gymnasium or a church sanctuary with mats on the floor or rooms with bunk beds. But emergency shelter can also be private with individuals or families having their own room, bathroom, and even cooking space. And it's also important to know that when a person is in emergency shelter, they are still considered homeless by the Department of Housing and Urban Development, and that their homelessness has not been resolved. And so this is why I want to stress again the importance of centering this key element around data and planning, because for many people, entry into emergency shelter can begin their journey to accessing more services to resolve their homelessness. And a perfect example of this is the recent Safe Stay communities. We've just passed the 1-year anniversary of the first site opening, and of the 79 individuals served there this past year, 33 resolved their homelessness through connections to housing or through self-resolution. And so emergency shelter allows people the opportunity to meet their most basic needs so that they can work on what is needed to exit homelessness. Next, we have the housing program. We have housing program assistance, and we'll start with rapid rehousing and transitional housing. And so the goal of rapid rehousing is to get someone housed as quickly as possible with progressive, time-limited engagement. I tend to think of the folks in these programs as having sort of a mid-range level of needs and barriers. In other words, they need more help than a household served by diversion, in that it's going to take more than one-time financial assistance, but then after a couple of years, they're able to permanently resolve their homelessness. And transitional housing has a time limit, usually up to 2 years, and the amount of assistance decreases as the household's stability increases until eventually that household is back to being stable in their housing. And so by getting people housed as quickly as possible, the amount of trauma with lasting impacts is reduced and allows people to avoid falling into chronic homelessness. And then still in this housing assistance category, the last key element here is permanent supportive housing. You'll notice here that rapid rehousing is still listed here because the goal is to get people placed into permanent supportive housing as quickly as possible so that they can then work on resolving other issues they have. For someone to qualify for permanent supportive housing, they need to have been homeless for a long time or repeatedly, and they have a physical disability and a mental health or addiction issue. So permanent supportive housing is exactly what it sounds like. It's permanent. The housing is permanent and the support is permanent. And there's no time limit, and the people who live here will likely always need it. They won't be able to increase their income or improve their health status enough to allow them the income to afford a place to live on their own. All right, so I think I'll pause here for questions. Anybody have any questions so far?
I have a question.
I have a question.
Sure.
I'm curious about, can you give me an example of what a permanent supportive housing might look like?
Absolutely. So we have several in our community. Permanent supportive housing can look like a site-based location. So we have Lincoln Place, the Elwood, the Meridian, the Pacific. Some of these are located along Fourth Plain, the newer ones. The Lincoln Place is very close to Share House. And then a lot of permanent supportive housing is actually what we call scattered site, which is just sort of mixed in with other apartment complexes or, smaller duplexes, triplexes, smaller places as well. So there's two different types. Some are sort of, bigger buildings with more, more units, like an apartment complex all dedicated to it. And then others are just scattered around the community.
Laura, this is Alicia. To follow on David's question and add a little more clarity, can you explain what the supportive in the title of housing means?
Yeah, so supports look like, whatever the person needs to be, successful and stable in their housing. And probably Cody or Maddie could delve deeper into the specifics, but it could be anything from, just regular meetings with a caseworker to determine, what's going on, what's needed, yeah, I don't know if Cody or Maddie, if you want to jump in with any specifics.
Sure, I can help out with that. So with permanent supportive housing, it is long-term rental assistance. along with intensive housing case management. So they have a long-term case manager, usually through one of our multiple partner agencies. So with coordinated entry, we are the referral point, so we don't provide the actual service. But we have multiple partners that we work with that provide intensive housing case management. They work with them around whatever their current situation looks like, whether it's medical need, helping them get connected to a caregiver, helping them get connected to Social Security, helping them navigate behavioral health services. And so it is long-term assistance to help them navigate whatever systems they need to. It can be meeting somebody once a week. It can be meeting somebody once a month that adapts to the individual's need. But it's also long-term rental assistance. Usually the individuals have an income, and we'll go into the income level when we get a little farther down into the presentation. But they're super limited income. They don't have the ability to increase their income for whatever reason. And goes from there. So hopefully that clarifies a little more as to what that question looks like. Sometimes they can be project-based vouchers like the foundational community supports. So that's a project-based Section 8 voucher that's still considered permanent supportive housing. Along with Lincoln Place, that's a project-based program that also is part of the VHA, part of the Vancouver Housing Authority and voucher system as well. So there's a few different arenas on that one.
Good. Thank you, Cody. That was good clarification. And thank you, Laura.
All right. And I think, were there other questions or?
I have a question. Can
Yes.
you explain perhaps, because I know that we talked about, or you talked about the fact that these are people with the highest needs and the most significant challenges. What, if anything, occurs if someone either cannot or does not wish to participate in case management or services?
So I think part of that also is the engagement piece when we talk to individuals and where actually somebody doesn't want to necessarily engage in the homeless crisis response services. It's a person-based set of services. So we can't force an individual to engage in services, but we make multiple attempts to at least build rapport and continue to have those conversations, potentially provide essential needs assistance as we go to start working through that. But we never force an individual to actually engage in services.
All right, thanks, Cody. I am noticing that my camera is like glitzing out. I don't know if anyone else is seeing that, but I apologize. I don't know what that issue is. Okay, so I think I will go ahead and continue if that's all the questions for now. And we'll have more opportunities too. This isn't the only one. Okay. All right, so next I'd like to jump into the guiding principles of our homeless crisis response system. These principles are the foundation of the work that we do, why we do it, and influence how we do the work. We work on the principle that housing is a basic human need, like air to breathe and food to eat. We believe that everyone deserves a safe, affordable place to live, no matter how much money they have. We believe that homelessness is a community issue that requires all of us in a community solution. And as seen earlier, we believe that all interventions must be data-driven, based on good outcomes, and are effective and responsible stewards of public dollars. There are also best practices that guide the system and the work that we do. Trauma-informed care means recognizing that people have many different traumatic experiences which often intersect in their lives, and well-meaning service providers can often re-traumatize clients who need understanding, support, and conscious care that focuses on an individual's strengths in all areas of the continuum of care. Racial equity and inclusion is also vital. Members of the Black, Indigenous, and people of color community in Clark County experience homelessness at a much higher rate than their white counterparts. So delivering services in a culturally competent way is not only trauma-informed, but it leads to better outcomes. And Housing First is an approach that prioritizes providing permanent housing to people experiencing homelessness, thus ending their homelessness and serving as the foundation from which they can pursue personal goals and improve their quality of life. And this approach is guided by the belief that people need basic necessities like food and a place to live before attending to other issues such as getting a job or budgeting properly or attending to substance use issues. Additionally, Housing First is based on the data that shows that client-centered services that encourage client choice in how they resolve their homelessness is valuable in housing selection and supportive service participation, exactly what Cody was talking about earlier, and that exercising that choice is likely to make a client more successful in remaining housed and improving their life. So I'll pause again here for any questions before we shift gears a little bit and turn to our homeless action plan. Okay, hearing none. So let's talk about the Homeless Action Plan. The Homeless Action Plan is a state requirement. It's a plan that is used to prioritize populations and services and to guide and evaluate a community's efforts to prevent and end homelessness. It's based on those guiding principles and best practices that I just reviewed. And the goal is to expand capacity across the entire system to facilitate continued system integration, expand data sharing, remember how data and planning is at the center of all of those key elements, and to provide client voice, lived experience, and racial equity. So, breaking news, the next homeless action plan for the upcoming 5-year period has been postponed by the Department of Commerce. But last summer, the summer of 2022, we dedicated that to getting community input from groups that were most impacted by homelessness. And so we have that data ready to go and ready to, inform the next plan when the work starts up on that again. But I do have some outcomes from the Homeless Action Plan. So every year we are able to analyze the outcomes and sort of score the different goals of the plan and determine if we're meeting the goals or not. And so the most recent full year that we have for that data is 2021. You can find all of this on our website. These are just a few highlights. Some of the successes from the plan in 2021, one of the most impactful things that happened is that the amount of rent assistance that went out because of a massive increase in funding for prevention that came in the form of rental assistance allowed the system in Clark County to serve almost 4,800 households to prevent them from falling into homelessness. Numerous partners and culturally specific organizations facilitated awareness of the opportunity for this assistance, which contributed to its success. That goes back to that racial equity and culturally competent service provision. And the number of households in 2021 increased from 2020, increased by 37 households. So a total of 515 households entered into a housing program in 2021. The Elwood opened, that's one of those permanent supportive housing site-based locations. That opened up providing 46 new spots. And exits from permanent supportive housing programs were only 1% in 2021. And that's a big decrease. It was actually 4% in 2020 and 12% in 2019. So we have been moving in the right direction for people falling out of permanent supportive housing programs. Also, in 2021, began the new coordinated outreach program, which enhanced collaboration between agency outreach teams and enhanced services delivery. 10 additional staff were added between Exchange Recovery, Recovery Cafe, Outsiders Inn, Council for the Homeless, non-youth, Columbia River Mental Health Services, and CSNW CMAR. So this brought the total number of outreach workers in Clark County to 24. In 2018, when this plan was written, we had 6 in Clark County. So that's a huge increase and has led to some really good outcomes. So I also want to note that 80% of those 24 outreach workers have lived experience of homelessness. Again, going back to those guiding principles about being trauma informed and having client voice in the service provision. And as the pandemic continued, the number of households new to homelessness actually went down by 4%, really thanks to that rental assistance availability and the effective local distribution of that assistance, I have to say. So the other key thing that really impacted that was there was some eviction moratoria that went on throughout the most critical points in the pandemic as well that kept people in their homes. We also had 44 veterans and 144 people experiencing chronic homelessness housed through that Built for Zero by name list that I was telling you about earlier. And a Safe Stay project opened up to provide 40 new emergency shelter beds here in the city of Vancouver, and also Bertha's Place opened to provide 60 new emergency shelter beds, prioritizing people aged 55 and older and single women. Another thing that was directly informed by the Homeless Action Plan when we determined that there was a big need for more emergency shelter for people over 55 and single women. And as always, there's room for improvement. So here are a few examples from the plan that the period just ended in 2022. This is not a comprehensive list, but thanks to that data and planning, we can identify these gaps and work to improve them in the next plan. The community is still in need of a 24/7 emergency shelter and navigation and resource center. And we also know that chronic homelessness is still increasing and that we need more youth shelter and housing programs. Youth homelessness is actually increasing and we need more youth-centered programs. So we also need to lower the rates of return to homelessness after rapid rehousing. And there's a need for more medical respite beds so that people are not discharged from hospitals to unsheltered homelessness. All right. That's it for my portion of the presentation. I'll open it up to questions one last time before turning it over to our housing hotline manager, Maddie Clems. I see Jamie.
Question, please.
Yeah.
Unless, this is Rob Perkins. I should probably just turn my camera. You're talking about more youth shelter. Are you defining youth as which age ranges?
I believe youth is defined up to age 24. So
that would include high school students and
yeah.
younger teenagers?
Mm-hmm.
Okay. Have you been able to coordinate with school districts and their McKinney-Vento efforts around that need?
Yeah, actually, I don't want to put Melanie on the spot, but I believe Melanie plays a role in that. But yes, we absolutely, the homeless crisis response system and the schools through the family community resource centers, it's a huge partnership. And the McKinney-Vento Act really does, that's a really good example of how knowing, the true, like keeping in mind what the barriers that kind of need to be removed in order to better serve people. So, allowing students to be served and be considered homeless, even though they may be couch surfing, which, our system cannot do for adults, allows much more trauma informed and critical services to happen in a faster way. So, I probably could ask Maddie to talk a little bit more about, or Cody, about the specifics in regards to the, the real programmatic side of that. But yes, there's a strong partnership there between the homeless crisis response system and the schools.
And do you have that relationship with each school district, or just a few in the county?
I believe it's every school district that has an FCRC.
Right now in Clark County, it's mostly through Washougal, Camas, Evergreen, and Vancouver school districts. They have the biggest FCRC kind of populations in their schools. We also have a lot of direct referrals that we're able to take from those FCRCs to get them stabilized and connected with youth outreach workers and diversion assistants. Usually we find that our youth, sometimes they need those like one-time assistance or those low touch programs where they just need that one-time rental assistance to be able to become stabilized.
Wonderful. Okay, thank you.
And I can share that Michelle Gaskin, the homeless McKinney Vento coordinator, and myself are part of the new ACI, Anchor Community Initiatives, which is part of Away Home Washington grant that was received for Clark County. And we're in close partnership with that group. And we've been trained on how to access some diversion funding for our youth and just starting to go on that. So there's a lot of really purposeful partnerships around supporting our youth experiencing homelessness that are part of families or that may be unaccompanied. So lots of partnerships. They're on my speed dial. We talk all the time.
But the center
We
of
feel
the
very
question is
fortunate.
around that couch surfing versus the federal definition. And we've advocated at sort of school board director level for the definition to match, to include couch surfing for youth or some kind of carve out. And I'm going to DC on behalf of the school districts of Washington later this month. So if there's something that we could add to, in our case, Marie Perez's first efforts. And we also have meetings with the senators and the Department of Education. So there's some synergy possible. Just tell me what I need to say.
Well, that's fabulous that you're getting to go up there. I know that.
You don't have to tell me now what I need to say. There's ways to go.
Of course.
I forgot to mention that part.
Well, it's like I'll answer all questions right now. Well, I'm super happy to get to be here today to just share a little bit more details about coordinated entry, the housing
Sorry, Maddie, to interrupt you. I believe we still had another question from Jamie, and we have one from our member David here in the room.
Yes.
Good to see you all, and thank you for the presentation. In 2021, I want to say early to mid 21, there was a lady at one of the partner agencies who was distributing some of that eviction prevention funding, who reached out to me with significant concerns regarding the number of people she kind of foresaw falling into homelessness even after receiving that assistance. So I was wondering, and not that you need to have the data right now, but I was wondering if you have it or if you could get two data points. One, the number of people who attempted to access eviction prevention assistance and did not receive it, and then the number who accessed that assistance and then subsequently fell into homelessness that we know of.
That is data that we probably don't honestly have right at this moment,
Right.
But we will get with Sunny and our deputy director, as well as our prevention manager, and see if we can get those data points for you in a timely manner.
Yeah, I wrote them down, Jamie. So the number of people who applied but didn't get it, and then the number of people who got it but still fell into homelessness. Was that what you asked?
Yes, please. Thank you.
Okay, yeah. We'll do our best. Okay, David.
Yeah, my question is going to piggyback on what Rob Perkins was saying. I was curious if you also are working with Washington School for the Deaf to make sure there's diversion for deaf people to not drop out of school and become homeless as well.
I'll turn that over to Maddie or Cody. I
So
might have
no,
to
we
get back to
don't
you.
have a formal partnership right now, but it is something that our equity and advocacy director, Shavonna McEwen, is actively working on, because that has been on our radar that we need to be having more formal partnerships with a lot of the buy-in for agencies in our community. So definitely on our radar.
So can I help in any way to make that happen? Because it should have happened a long time ago. And so can you guys connect with me so I can get you guys connected with Shauna Bayou, the superintendent, please?
100%. Laura, are you taking notes, or should I? So we can
No,
make sure
I am. Yeah, thank you.
Fabulous. And we'll definitely reach out to see how we can move that forward.
Maddie, I'm also putting my contact information. This is Destiny, Executive Director for Council for the Homeless. I'm putting contact information in the chat for you for us to connect, David.
We'll make sure that we provide Cecily's information in the follow-up to the email. We do not use the chat for this advisory board meeting because it's not accessible to everyone participating. But we will make sure that we have that information available. It also looks like Michael has his hand raised.
Yeah, just a couple things in terms of the prevention assistance, rental assistance. One is the question of who applied and was denied. Generally speaking, everyone that was eligible who applied has received assistance or received assistance. A lot of the cases, or most of the cases of denial, for someone that was income eligible is because they were applying for a second or third, well, a second round of assistance. Part of the local criteria that we implemented was that people would receive rental and utility assistance from all the eviction rental prevention programs once. We reviewed that. That was a decision we took locally. The county did in consultation with our service providers, and we did consult with the Department of Commerce, and they were okay with that local guidance that we had. And the reason that we took that policy decision was because demand was high enough that we wanted to make sure that as many households that needed rental assistance as possible would receive it. And that a household that needed the rental assistance would not be denied it because we ran out of resources because another household received more assistance more than once. So, just FYI, to my knowledge, no one who is eligible was actually denied rental assistance, unless they had already received it. So for the ERAP program, or the eviction rental assistance program with Treasury dollars, between March 1st, 2021 and December 23rd, 2022, 6,852 households received eviction rental assistance, utility and rental assistance. 60,581 months of assistance were provided. 55,990,415.57 in rental and utility assistance went out to this community. And the average assistance per household for those 6,852 households was $8,171.40. So that's what we saw in terms of what went out. When we talk about prevention assistance, you also have to see this is everything that went out, and I think it did a lot of good. I'm very proud and happy about the work that our service providers did in our community. I'm thankful for it. But also remember, that's rent assistance, and what we see in visible homelessness still increased regardless. That's the reason why we really tried to do targeted prevention try to identify the households that are most likely to become homeless if assistance is not provided. And then the only other thing, the reason I've just raised my hand to answer questions that were asked as best we can, is in terms of what do we know in terms of how many households will become homeless? Well, of the 6,285 persons who identified as homeless in 2021, 3,800 indicated that they were newly homeless. And I'm basing that on the 2020 Homeless Crisis Response System report that Council for the Homeless publishes. The U.S. Government Accountability Office estimates that every $100 increase in median rent is associated with a 9% increase in estimated homelessness. So when we look at the data locally, according to Zillow, as of October of 2022, the median rent in Vancouver was $1,998 with a month-over-month change of plus $103 and a year-over-year change of plus $345. So based on how many people identified as homeless in 2021 and those current trends, it's very possible that over 4,800 persons will indicate that they are newly homeless throughout 2022. We don't know those exact numbers yet because we haven't done that data analysis and published those numbers, but you know, there's a very real likelihood that we will have more newly homeless last year than the year before that, and that has nothing to do with how much assistance went out into the community or how we triage that assistance. It very much has to do with what the economics and market is locally and nationally, and how much resources available. So that's the data we have right now.
Yeah, thank you so much, Michael. That's really helpful. All right, so I'm going to turn things over to Maddie. So Maddie, go ahead and take it away, and I will be your PowerPoint clicker.
Thank you.
Yeah.
And thank you so much for those numbers, Michael. That was fabulous. Well, I'm really excited to share just a little bit more about coordinated entry and get into the details with you all today, as well as talk about the housing hotline and emergency shelter in our community. Thank you so much, Laura, for that great overview of the homeless crisis response system. And if we could go to the next slide, that would be great. All right. Just want to talk about what is coordinated entry. Coordinated entry functions as a one-stop access point for almost all of the shelter beds and housing assistance in Clark County. Coordinated entry and assessment provides the quickest access to the most appropriate housing to every eligible household within the continuum of care that Laura mentioned, using a standardized assessment and placement process. Prior to implementing coordinated entry in our community, someone experiencing the trauma of homelessness would first have to identify all of the agencies in the community that provided assistance they need. Currently, we have about 10 in our community. They would then need to physically go to those agencies, complete their application processes, comply with their requirements to remain eligible, like checking in, for example. And they must do that with every agency to access services. We can imagine how difficult that would be for someone experiencing homelessness. If that individual or family is selected for a placement, it may be the wrong amount of help they need. For example, receiving moving costs when they need permanent supported housing. In addition, community agencies have only one place to go to connect with their clients that are eligible for the programs, as verified by coordinated entry providers. Coordinated entry, as we do it now, is that one-stop access point. They're not having to go through all of those placement processes and eligibility criterias. This ensures that the people that need it are provided these scarce resources and receive them first. Next slide, Laura. So what are the access points to access coordinated entry in our community? Right now, the main access point is going to be the housing hotline. But in Clark County, we also operate on a no wrong door approach. What that means is we strive for households to be able to access services wherever they may be at in the community and with whoever they may be working with in our community. The housing hotline is the main access point, and the housing hotline operates with the lens that all or most of our callers are in varying levels of crisis, and we try to provide trauma-informed and empathetic guidance to meet callers where they are at and minimize as much crisis and trauma to accessing services as we can. We know that homelessness is trauma. We also understand that due to systemic racism and discrimination, there can be distrust in systems, especially for our BIPOC and LGBTQ community members. We're always trying to make sure that at the housing hotline, our screeners and operators are working with an equity lens and working to disrupt the cycles of provider trauma. Street outreach and community partners, we also work closely with within the coordinated entry system, that no wrong door approach that I mentioned. As we move through this presentation, we're going to hear more from Cody Shaw, our outreach manager, and he's going to talk a little bit more about how street outreach works and how outreach works really closely with our community partners to provide consistent and additional access to coordinated entry. Next slide, Laura. So now I want to talk a little bit about why coordinated entry. We've kind of dived into it a little bit more, but I just want to talk about why it's important. As I mentioned earlier, having understandable and set access points for shelter and housing programs simplifies the process for clients and lessens the cycles of provider trauma that we so often see. As a community, it also helps us have shared goals and practices among our community partners. For example, in Clark County, every agency who is providing assessments utilizes the same assessment tool. The assessment tool we utilize in Clark County is called the CAAB, or the Clark County Assessment Tool. Cody will be going into more depth about that here shortly as well. Coordinated entry also helps us to ensure that we're placing clients in their best fit program, which is based on the unique situation a household may be going through. The housing assessments with the CAAB screens a client for their vulnerability. This allows us to place the most vulnerable clients into the available housing placements, prioritizing those with the most need for these very limited services. Next slide, Laura. So this is just a continuation of the previous slide that just provides a few more examples of why coordinated entry is important. I want to give us a hypothetical example on why ensuring everyone is assessed for the same services is so important. So why all of our agencies using the same assessment tool is important. In Clark County, we use our assessment tools as the best practice to screen for vulnerability. Imagine if everyone in the county used a different assessment tool. We would have no way of guaranteeing we are placing households based on vulnerability, making sure that the most vulnerable person is getting these services. Placing into housing programs based on vulnerability is the evidence-based best practice to ensure equitable access to services. As the last bullet point says, this maximizes the impact of the limited housing placements we have in the Clark County community. Next slide, Laura. So I want to talk through a little bit more about the housing hotline. The housing hotline is currently open 7 days a week, 365 days a year. Households in need are able to call and know that they are being connected with every possible shelter bed and screened for possible housing programs in the community. We have learned through our data and the voices of the people we serve that having an access point where households know they are being connected with every possible shelter bed is crucial to lessen the trauma a household may go through to locate these needed services. I know we have all experienced calling a business or an agency after waiting on hold, being told you need to call another place and call another number. We've all experienced that frustration. Now imagine experiencing that frustration, worrying about where you're going to sleep that night or where you're going to eat, what you're going to eat that day. That's why the housing hotline is so important. Our goal is to get the client as much information and services through one phone number. When someone calls the housing hotline, they're going to be asked some questions to see if we're the best resource to assist. Clients will go through an intake process and screened for available shelter or motel vouchers, and if applicable, referred to a shelter or placed on our shelter wait lists. We also provide a housing assessments through the housing hotline, that CAAB assessment I mentioned earlier. Clients will be connected with a housing coordinator to go through assessment and placed on the radar for applicable housing programs. When rental assistance is available, as we've already talked about today, we do a bulk of those screenings online and then a bulk of those screenings through the housing hotline. When COVID-19 hit, we saw the need for rental assistance skyrocket. Thanks to COVID-19 assistance that came into our community, over $60 million in rental assistance went out to the community. That was phenomenal. Currently, we're not screening for rental assistance at this time, but we always update our website, social media, and let folks know who are calling the housing hotline when we're screening for rental assistance. Lastly, on this slide is resource navigation. Resource navigation is a crucial part of the housing hotline. Folks need and want to know where they can get clothing, showers, and food, among many other questions, so they can meet their basic needs day to day. We keep an updated and extensive list of community resources, so we're able to inform households where they can get their basic needs met. Next slide, Laura. I also wanted to share a few other of our partner agencies that have specific shelter for specific populations. The housing hotline is not the access point for these 3 shelters, so I always think it's important to make sure folks know about them. The housing hotline will tell callers about these options when they call. Safe Choice is our only domestic violence specific shelter in our community. Open House Ministries is a faith-based family shelter. And Oak Bridges is a shelter that is specific to youth under the age of 18. The housing hotline currently is not able to serve or place folks under the age of 18, so Oak Bridge is a great resource. Before I move on to talking more about emergency shelter, I want to pause and see if there's any questions so far. Okay, not hearing anything, so we will move on. Next slide, Laura. So I want to dive into a quick inventory on how many emergency shelter beds we have in the Clark County community. Year-round, we have 368 shelter beds. In our severe weather months, which is November through March, we have 97 additional beds, thanks to wonderful community partners that increase their capacity to get more people inside on our coldest nights. In December of 2021, we had the largest new addition of new shelter beds to our community through Bertha's Place and Bertha 2 shelters. Bertha's Place brought an additional 62 beds, and Bertha 2 brought 26 additional beds to our shelter capacity. Both of those are included in the 368 beds I mentioned above. These shelters serve couples, single women, and men over 55, with the priority being seniors. As Laura mentioned, seniors is one of the highest growing populations experiencing homelessness that we're seeing. In 2022 alone, the housing hotline received 17,455 calls requesting emergency shelter. So we can see that there's still a great need for this shelter despite the increases that we're seeing. The greatest need being for single men and families right now, as we have the least beds for that population. You are on it, Laura. Thank you. Now I want to provide some information on what do our shelters in Clark County look like. In the homeless crisis response system, we typically classify shelters in 2 types, non-congregate and congregate shelters. A congregate shelter is what we typically think of when we think of a homeless shelter. It's a dorm setting where folks are sharing space, typically bunk beds, little to no privacy, less safety, and higher transmission of contagious diseases. When COVID-19 started, congregate shelters typically had more outbreaks than our more private shelters. Next slide, thank you. Now we come to congregate shelters. These are shelters where a household has a private room and they're not sharing with another household. We find that these shelters, clients have higher feelings of safety and autonomy. Clients are able to feel respected and human. We know that when someone falls into homelessness, they feel invisible or less than human because of how society treats them. Giving someone the dignity of having their own space is one of the greatest gifts we can give someone. These shelters are also innovative. We've seen in Clark County and other counties, creativity is being used in how spaces are used to provide more privacy for households. A few examples of that are through the use of hotels or our safe state communities in Clark County that are utilizing pallet shelters. Next, I want to give an overview of alternative shelter programs outside of our standard shelter programs. One of those options is motel vouchers. We provide motel vouchers to the most vulnerable in our community, and we utilize a screening tool to do this. This program is limited based on capacity, and it's most commonly used to move clients closer to housing and meet basic needs such as shelter from severe weather and hygiene. We recently have piloted an innovative new program to provide motel vouchers through our street outreach teams. Historically, only the housing hotline could provide vouchers, so it was a big step for now outreach teams to have access. We identified that sometimes the most vulnerable clients are not calling the housing hotline. They're engaging with our street outreach teams. The most vulnerable in our community may not have the resources, such as being able to charge a phone or having a phone to call the housing hotline. This pilot program with our outreach teams has ensured that we're providing vouchers to those who need it most and ensure that they are moving clients closer to permanent housing. We also utilize motel vouchers to provide bridges to housing. A bridge is a term we use to describe the act of vouchering or sheltering someone until they're able to move into housing. We typically only provide bridge vouchers when a household has a set move-in date for housing. Lastly, on this slide, one of the last ways we provide vouchers is in medical situations. We work closely with medical providers to offer shelter when someone is exiting a hospital into homelessness or going through health conditions on the street. I would like to share a story of a client I had the pleasure of working with. This client was homeless for almost 20 years, and during her time working with Council for the Homeless, she was diagnosed with cancer and began chemo treatments. When street outreach workers began working with her, she had been recovering from her chemo in her tent. We were able to set up motel vouchers to give her time inside to recover during her chemo, and this client was ultimately housed by Council for the Homeless. So I really appreciate that story as a way that motel vouchers are able to meet those medical needs and help us move someone closer to housing. Next slide. This is kind of a continuation of those medical respite rooms, but we also have very specific shelter beds in our community called medical respite rooms. Through a partnership with our family shelters and Peace Health, we do have some medical respite beds in our community. Peace Health is able to directly refer folks into these beds when they have clients exiting the hospital into homelessness. But as Laura said, we still see a great need to have more of these beds in the community. All right. Laura kindly introduced us to the concept of the housing first approach as a best practice in the housing crisis response system. I want to run through a few points on why this practice is important when we're talking about shelters. All of our shelters in Clark County operate on this principle. So having few to zero eligibility requirements is important when folks are entering into shelters so that they're able to come as they are and be sheltered, because we believe that housing is a human right. People are welcome regardless of their barriers, and there's going to be case managers there that are able to meet with the client to work on what they identify as a barrier. Focuses on housing households as soon as possible. So those are that case manager piece I mentioned, so that we can get people out of shelter and into safe and secure housing. Being sheltered equals safety. We can't expect someone who is outside and going through the trauma that is homelessness to be able to feel safe enough to work on housing. And in our community, arbitrary length of stays have been eliminated. So folks are able to stay in the shelters as long as it takes to get them housed. Next slide, thank you. I also wanted to include this slide because I think it's super important to shed some light on why some folks don't want to go to shelter. We commonly hear discourse that there are open shelter beds and folks should go into them. But we see when we're talking with folks on the street that there can be previous bad experiences, a belief that there's never any openings anyway, feeling that where they're currently at is a better option, safety like we've talked about. People not being able to take their pets with them, not having enough storage for all of their possessions, and cultural concerns. I think the reason that it's important to have the discussion on congregate shelters versus non-congregate shelters is because congregate shelters, so where they're not having to share a room, these alleviate a lot of these concerns that we see on these slides, where building more non-congregate shelters is crucial for the dignity, safety, and autonomy of households experiencing homelessness. All right, so I want to end my section before I pass it over to Cody on talking about a local case study that is local to our community. Bertha's Place is one of the newest shelters in our community. They came up and running December of 2021. And it shows a lot of innovation in our community. The bullet points on the screen go over what Bertha's Place is like and how folks get placed there. Folks have privacy, they can have their pets, they can store belongings, they can cook and have private bathrooms. Treating our houseless community as human and with respect is one of the greatest strengths we can provide to help move someone out of homelessness. This shelter is a great example of how we as a community came together to provide needed services to get people off the streets and work towards housing. And this shelter is a fabulous example of how all those concerns that people have of going into shelter, how they can be alleviated. So I'm going to turn it over to Cody Shaw, our Coordinated Outreach Manager, and he will be talking more about outreach, housing assessments, and housing programs, giving you a little bit more details on those. But I did want to pause and see if there was any questions.
I actually have one quick question, if that's okay.
Yeah, of course.
So, you mentioned respite beds. Medical respite beds are a growing need. What does that process look like? So, is somebody time limited when they're in a respite bed, or are they just now a shelter resident? What does that look like?
Yeah, so right now for those Peace Health specific medical respite beds, there is a time limit on those. Those are actually our only shelter bed in the community that have a time limit. But what we've seen in the community is the shelter providers that house those medical respite beds do everything they can to make sure they can transition them into another shelter. So I usually work pretty closely with those folks who are transitioning out of a respite bed so we can try to prevent them from going outside on the streets.
Thank you, Maddie.
Of course.
Any other questions before we move to Cody?
Well, thank you, everyone.
Thank you so much, Maddie. Definitely appreciate you and all of your work. And I know this has been a lot for everybody to ingest. The system is pretty extensive. So I'm going to try and keep this as brief and concise as possible so we can potentially get into more further discussion. So my name is Cody Shaw. I'm the Coordinated Outreach Systems Manager with Council for the Homeless. So I'm going to cover a little bit about our coordinated outreach process, and then we're going to walk down what the assessment process looks like when we're working on placing people into priority pools, what our priority pools look like, and what the placement process looks like for placing people into permanent housing. So first is I want to talk a little bit about what coordinated outreach is. So coordinated outreach is a new system that we just have established within the last year. So coordinated outreach is a collaborative effort between all of the street outreach providers here in Clark County. Currently, we have 7 different agencies that provide some form of street outreach between now and 2022, now 30 outreach staff on the street. So street outreach focuses specifically on individuals who are experiencing unsheltered homelessness. So coordinated outreach also helps create a standard of set practices and procedures and best practices across all agencies. So everybody's on the same page and has the same tools, and we're all doing the same work. It's really designed to enhance the shift to a no wrong door approach with coordinated entry. The idea that somebody needs to go to a building, or they need to make an appointment, or that they need to make a phone call when they may not have phone access is limiting to what they're able to do. So we're really using this to expand individuals who may not have engaged the system beforehand, or who can't engage the system in the traditional manners. Next slide, please, Laura. So coordinated outreach provides a few different angles in what we're able to, and services we're able to provide. First, it integrates case management, housing navigation, and behavioral health services. We have teams such as Columbia Rivers Mobile Medical and Lifeline's host team that actually bring out medical and behavioral health services to individuals directly on the street, regardless of housing. It connects unsheltered clients to needed resources. We're able to directly refer along with the housing hotline into shelter. We're able to, with the help of the motel voucher pilot, get them connected into a motel temporarily to help circumvent any needs. We're also able to do a lot of work financially with the flexible funds that we currently have, helping individuals navigate any potential housing barriers that they have. So whether it is back rent that's due, back utilities that's due, they need the financial assistance to get their license, their ID, or their birth certificate, those kinds of things. Also working on diversion principles and helping individuals with rental assistance or moving costs. Street outreach goes out into the field to perform the housing assessments as well. So whether it's the CAAB assessment or the VAT assessment, which we'll talk about down the road. So this helps clients become a little more housing ready while they're waiting for placement. They also do longer term case management with the individuals. So it is a soft touch case management. So it's not super intensive, but they're able to work with them around their housing barriers and help them get connected to other additional services. And as I said, there's 30 staff across 7 different agencies right now, between Columbia River, Community Services, Northwest Seymour, Lifeline, Outsiders In, Exchange, Council for the Homeless. We also work with the city's Heart Team and multiple others. Next slide, please. So I want to go over a little bit of the different approaches that we use with coordinated outreach. First is resource navigation and case management. It's one of those things that is what we have discovered in this is that traditional street outreach was always putting out fires. We were always, here's a blanket, here's a tent, here's this, to basically get you through the moment, but we weren't being proactive in how we were doing things. So we shifted gears to allow for light touch case management and to do more focused work to help move people forward. We do provide essential needs items, tents, tarps, sleeping bags, clothing, food kits, those kinds of things as well. But we do that in conjunction. So essential need items that are provided by coordinated outreach or the street outreach staff, they're provided to individuals that they're actively working with. So we're not just dumping things into the system, we're being more focused on how we're actually, what we're providing and how we're providing it. We also have shifted towards a diversion lens and focused on flexible spending. So we have flexible spending accounts now that we're able to use to help people move forward. On a national level, 40 to 60% of individuals who are experiencing unsheltered homelessness are working, have gainful employment. their biggest barrier is getting connected to the moving costs. Not a lot of people, when we're trying to afford to survive, homelessness can be expensive. What most people don't understand is that homelessness can be expensive. Trying to navigate through the system on your own without any assistance can be daunting. So being able to stack up the 2 months of rent and security deposits becomes almost impossible. So what we've been able to do is use these diversion funds to help with those moving costs so that people can self-sustain in their own housing at that point. We're working with Community Solutions and Built for Zero and the by nameless case conferencing process that Maddie had talked and Laura had talked about. So with the by nameless case conferencing process, what happens is all of the providers, not just outreach, but multiple other shelter providers and case management come together twice a month, and we talk about each individual by name based on their specific needs in order to get them housed. We've seen a significant decrease in our population by doing this more focused and targeted approach than a blanketed approach, because we're able to actually identify what's happening there. And we're able to really focus in on getting them housed instead of just throwing a blanket over it and hoping that people figure it out. We also now have what's called the Coordinated Outreach Work Group. So we have a monthly meeting of all of the outreach providers. What's amazing with this group is it allows all the outreach providers to have say and have buy-in as to what happens with street outreach here in Clark County, and also what next steps are. So each agency has input, so it's a collaborative effort rather than an overarching dictatorship. Next slide, please. So one of the things that we've also started to do is allow street outreach to have direct access to housing placements. So we started a new pilot. There's not a lot of data behind it, but we're super excited about where this is going to go. We've already seen some really great work with the opening of the Meridian, as well as filling the Elwood. So with the Meridian, we took a very different approach in placements. So we put them into the hands of street outreach. So street outreach were able to identify individuals who qualified for the FCS program, which is Foundational Community Supports, which is one of our permanent supportive housing programs. And then from there, we were able to work collectively and collaboratively, both with the housing program providers, as well as with homeless service staff and behavioral health providers, to connect all of the dots needed when it comes to getting assessments, medical assessments that were required, or mental health assessments that were required, or behavioral health assessments that were required. We were able to decrease the timeline from when an individual was referred to a program to when they got their keys by 25% in 2 months. So, like I said, this is just initial data. So we're super excited to see where this data is going to continue to flow in 2023, and we'll keep you updated from there. So before I dig in, you want to go back one slide, Laura? Before I talk about the assessment process as well as the placement process, does anybody have any questions specific to the outreach process?
We have a question in the room.
My question is clarification of the last part, the last slide. You're talking about Meridian and Elwood. They should be part of the new FCS Coordinated Outreach Pilot Project. I didn't really understand, how did it get a faster time between engagement and getting in the housing? What can you summarize what happened? And again, clarification, FCS means?
FCS is Foundational Community Supports. So it is a Medicaid funded program. It's a Medicaid funded voucher program. So it's specific to individuals who receive Medicaid, but also qualify for permanent supportive housing. So with that, what happened was we were able to work in a collaborative unit. So when outreach identified individuals on the wait list, we were able to go through and identify the most vulnerable and people who had the length of time homeless, and then looked at the requirements for Medicaid and Medicare. So street outreach were able to get all of the intake process done prior to even sending in the referral. At that point, we were also able to use the mobile medical and the host teams, which are outreach behavioral health providers, to get their, because that program requires that an individual has either a mental health challenge or a substance use disorder, and it has to be a verifiable diagnosis. We were able to use those teams to go in and meet people in the field instead of what now takes up to 2 months to get in for an assessment. We can get it done in a shorter amount of time by using mobile medical and behavioral health. So we were able to get those assessments done quicker, get them, their turnover time to get the assessments became 24 to 48 hours. And so then we were able to get that and get the approval process done a lot faster because we had all the documentation needed in a more collaborative way.
I wanted to just quickly say, number one, I know you don't have any data on that yet, but I'm a big fan of outreach being able to refer to FCS. And I can tell you that every outreach team, including the Heart team and as well as like the Safe State communities and the Safe Park, were able to get people from the streets, from those shelters, from the Safe Park, very quickly onto the FCS list and into the Meridian as soon as they opened up. So big fan of you guys' coordinated outreach work.
Thank you, Jamie. I appreciate you. Any other questions? All right, so
Wait, I got a question.
Yes.
So are those people, because the people that live in Elwood and stuff, are they what was I gonna say? Like, there's a lot of crime that goes on there. And the other place too, that I just am wondering, like, you said there's the mobile mental health something, right? You said, okay, do they work with all these people in there, or is that?
So with the outreach teams, what happens with them specifically is if an individual moves into shelter, then they have up to two months to transition them to shelter case management. The same happens with housing. So with housing programs, once an outreach team, the individual has identified housing and they've moved into their housing, at that point, we have 2 months to transition them into working with their housing case management. But in the meantime, usually, if the individual wants to connect to those services, is the key component, is that they're able to, mobile medical and behavioral health, like the host team and Columbia River, are able to connect them to long-term behavioral health services. Again, that component with those programs is, while they need the assessment, they're not required to continue services. So most of them will continue services, but a portion of them won't. But what happens within that is that then the housing case management continues to work with an individual and continues to engage them to move forward with services. What we have found over time is that individuals using a housing first approach, when you place an individual, it's extremely difficult to get people to want to connect to behavioral health services when they're on the street. It's hard to get people to keep appointments times because they're trying to meet their basic needs. I'm not focused on making a medical appointment. I'm not focused on, going to see my therapist when I'm trying to figure out where I'm going to eat or how I'm going to eat or how I'm going to shower or how I'm going to wash my clothes. So when we house them first, then we are able to get them connected to those other services Sometimes there is a struggle to get there, but that's kind of, I will say, that's kind of outside of our scope at council. That is more specific to the agency itself when it comes to once an individual is housed.
Thank you.
Question. Other than the obvious, we need more supportive housing in this community and low income and affordable housing. Is there anything in particular that you feel like outreach as a whole needs to do more of what you guys do so very well?
We need additional funding for rental assistance, like moving costs. We've been able to move individuals in for, we've been able, using that diversion approach, to move hundreds of individuals into housing, but without the sustained, that practice falls out when we don't have the funding to do so. So a lot of that was reliant on, a lot of that was used during COVID dollars. So some of that funding was decreased over the last year because it just wasn't there, but that would be a biggest thing. Also, you know, we can always use additional supports for staffing and increasing the population. Currently, we have 30 staff. If they're at a case capacity of 20, which is our average, we're hitting 600 individuals when we have a population of well over 2,000. So, you know, we can always use additional funding to continue what we're doing.
In addition to housing units, we need more rental subsidy.
Yes, as well as diversion funding for moving costs. So, any other questions there? All right, take you guys on that one. So I'm going to talk now on the part that tends to be a little more elusive for individuals. So I'm hoping that we're able to clarify a lot of things today when it comes to the assessment tools, how we determine an individual's vulnerability, and how priority pools work and how people are actually placed into program. So the first thing I want to talk about is what we call a coordinated assessment, which is the CAAB tool. It's the Clark County Assessment Tool. So the Clark County Assessment Tool measures a household's vulnerability, or as we break it down, their likelihood to die on the street. So this is a derivative of the VI SPDAT. What Clark County did was recognize that we had a great tool, but we were missing components when it came to racial equality, as well as individuals in the LGBTQ community who face housing discrimination at higher rates than their counterparts. So we were able to adapt that to do some work around that. The CCAT as well as the VAT assessment are currently getting additional makeovers to continue to do that anti-racist equity work and make those tools more equitable in what they see. So the CCAT currently works based on age, length of time homeless, episodes of homelessness. So when we talk about chronic homelessness, we're looking at individuals who have been homeless for at least 12 months consecutively, or they've experienced 4 incidences of homelessness adding up to 12 months within the last 3 years. Also, we look at their interactions with emergency and medical services, any medical conditions that they may have, any histories of substance use, mental health, their family unit, as well as additional past traumas. So there's 3 different types of CCATs that we do. One is for single adults, one is specific for families who have minor dependents, and the other one is for youth between the ages of 18 and 25. Each of those are slightly different based on identifiable areas that change within those 3. These assessments are based on client self-disclosure to basically 60 yes or no questions. They're focused on what the client tells us. So an individual, the person who conducting the assessment, keeps the same standard of what they're doing and also does not interject their own input or their observations into the situation on this one. It's used to place households into 3 separate priority pools, which we'll talk about in a minute. But the higher the score, the higher their individual's vulnerability and their likelihood to die on the street. Next slide, please. The second tool that we use is what we call the Vulnerability Assessment Tool, or the VAT. So it was a tool that was created by DESC, and it's a national best practice that helps us get a bigger picture of a client's vulnerability and their barriers to housing. So this is used specifically for individuals who have a CCAT score of 12 or higher, or who what we deem as required permanent supportive housing. So the VAT assessment is conducted as an interview rather than a set of yes or no questions. It's a standardized interview, so this staff member who's conducting that training goes directly from the book, so we get the same amount of the same baseline around that, but they're able to get a broader picture of the individual's vulnerability, barriers, and needs, and they are able to interject some observations within that. So if an individual is actively symptomatic or they're actively under the influence, we're able to have a bigger conversation around that. But a VAT is actually required for all of our COC permanent supportive housing programs. So anything that's received COC funding, a VAT is required for that. So we're going to talk a little bit about priority pools. So what happens when somebody has their assessment is they're placed into one of 3 priority pools. So the priority pools are used to prioritize clients for housing placements and housing assistance. They don't function the same as a normal wait list. So it's not first come, first serve, but rather the priority pools are deviated out based on the individual's length of time homeless and their vulnerability score derived from the CCAT. Next slide, please. So the first priority pool is what we call diversion. You've heard that word used a few different times. So these are individuals who have a CCAT score of less than 7, or they self-select after the conversation with the assessor. So these are individuals who have few to minimal barriers. Realistically, these individuals are able to navigate, they just need assistance navigating or learning where the affordable housing may potentially be, helping with application fees, and sometimes assistance with moving costs. There's no long-term rental subsidy with diversion, so it's a one-time shot. So the individual has to be able to immediately self-sustain their permanent housing directly after that. Next slide, please. The second priority pool is what we call rapid rehousing. So with rapid rehousing, it's a medium length of rental assistance, at least 90 days, but can go up from there depending on the program. Rapid rehousing programs usually cap out at about 2 years of rental assistance. So they're designed for individuals who have some significant barriers, but they're able to self-sustain with moderate assistance. So assistance with moving costs and a few months of rent to help them get on their feet and moving forward. Individuals who are eligible for rapid rehousing, my brain is not working anymore at this point, vary usually between, there's a requirement of 0% AMI to 50% AMI. And when we talk about AMI, we're talking about average median income. So the maximum amount of the household is able to make. So there is a cap on that. Sometimes those individuals can be, when they work with coordinated outreach, if they've assessed into rapid rehousing, we often try to work with those particular individuals to bring them down to diversion. So they need less subsidies, just using resource and barrier navigation. And then the last one is the one we talk about a lot, which is permanent supportive housing. So permanent supportive housing is long-term rental assistance along with intensive housing case management. These are individuals who show multiple significant barriers. In order to qualify for permanent supportive housing, an individual has to meet HUD's definition of chronically homeless and have an identified, verifiable disability. So they have to have either be on Social Security and be able to get us that verification, or we actually have to have diagnosis from a medical provider. These individuals have a max income of 30% AMI. So they have to not be able to self-sustain on their own. And these are also the individuals who are the most likely to die on the streets. Part of our permanent supportive housing programs is areas like Lincoln Place, as well as the Meridian, Elwood, the Pacific, as well as some other scattered sites. So that's a basic breakdown of what that placements look like. Does anybody have any questions? One last quick note before I open it up is that in order for an individual to be eligible for either one of the assessments and to be assessed, an individual has to meet the HUD guidelines for literally homeless. So meaning they have to, the night before, have to have slept outside on the street, in the vehicle, or any other place that was deemed as not fit for human habitation, or an emergency shelter, or be actively fleeing domestic violence. Looks like Jimmy has a question.
Of course I do. Has there been any discussion about the possibility of utilizing more than that assessment tool for prioritization or placement on the priority pool? Like instead of just the self-report tool, also utilizing, collateral information from like case managers, outreach workers, things like that.
At this time, there is some discussion around what the CCAT is going to look like. They are starting a work group to rework the CCAT and make it more equitable and make sure that we are prioritizing appropriately. But I don't have a definitive answer as to the discussions of using collateral or changing how the coordinated entry placements would actually go. That would be a great question for our coordinated entry director, who is currently not available. She's flying to Wisconsin today, but I would strongly suggest you could email Melissa Baker or Cecily around those questions.
We have a question from the room.
Yes.
I want to just clarify something. So if a person's going to try to get qualified with you guys by doing those assessments for either rapid rehousing or for permanent supportive housing, they have to be literally homeless by the HUD definition, which is on the street or in a vehicle for how long? Is that like 1 day, 1 year? And you said fleeing domestic violence shelters are counted. Also, like all homeless shelters, emergency shelters, winter housing shelters, and I missed if there was something else.
No, that was it. So with the assessment, they have to meet the HUD definition the night before. So that's kind of the caveat in that. However, there's a lot of different timelines that are going to happen when we're assessing an individual. Some individuals have been homeless longer. There is also a caveat around our youth programs. Some of those do also allow for couching. So if an individual who is under the age of 25, some of those youth programs allow for individuals who are couching to still qualify, but those are youth specific programs. At this juncture, there is some discussion around the equity of that, but that would not be a question that I would be able to answer at this time as well.
I appreciate that answer because, discussed it before, and now I have clients that will come to me where I work and they may have just been homeless one night and I wasn't sure. I just tell them to contact you guys, but it's good for me to know what to tell them to expect.
Yeah. I'm happy that we were able to offer more clarification.
Not seeing any other questions, I really want to thank Council for the Homeless staff for coming and providing this in-depth information for the Community Action Advisory Board. Thank you so very much.
Absolutely. Thanks for having us.
Yes.
Thank you for your time.
Thank you. All right, so I believe that is the end of our meeting. Are there any final questions before we wrap up for the day and a little early? Rebecca, we're still seeing your screen too, by the way.
I am trying to get it to go to
Oh,
the
okay.
PowerPoint and it doesn't want to, so I'm,
Okay.
but all it said was just last business and our next
Okay.
meeting will be in March.
Okay, yeah, Wednesday, March 1st. Do you know what, is it 9 o'clock?
Yes.
Okay, perfect. All right, well, thank you so much, everyone. If there's no final questions, we'll end our day and see you all together in March.
Thank you, everybody.
Thank you.
Thank you.
Thank you, everyone.